Public hearing to order. Good evening and welcome to everyone joining us here today. My name is Shayla Favor, and I serve as the chair of City Council's Criminal Justice and Judiciary Committee, as well as our Health and Human Services Committee. We are hosting this meeting tonight to discuss Columbus Public Health's proposed legislation to regulate the sale of flavored tobacco in the city of Columbus. The proposed legislation is live and can be accessed at www.columbus.gov/tobacco. Please allow me a moment to introduce my colleagues who have joined us this evening. Councilmember Nick Bankston, who chairs our Small and Minority Business Committee, as well as Council President Shannon Hardin. Flavored tobacco has been a hot topic of discussion, not only in our city, but all across our country. In April of 2021, the FDA announced its plans to ban menthol as a categorizing flavor in cigarettes and ban all categorizing flavors, including menthol, in cigars. While the FDA has yet to pass legislation, to date, 8 states and 360 localities have passed restrictions on the sale of flavored tobacco products. Of course, each of the laws differ in their application and specification. A few months ago, the Coalition to End Tobacco and Columbus Public Health presented an initiative to Columbus City Council that would regulate the sale and distribution of flavored tobacco products within the city of Columbus. From the beginning, City Council's goal has and continues to be to listen. We want to hear from all of you, all of our residents, our health experts, and businesses to really understand the complexities of this issue. I want to reiterate once again that nothing has been decided upon yet. When we created our engagement strategy on this issue, we were intentional in planning for a very robust plan for community engagement. Starting with the community conversation we held on October 25th, the small business meeting on November 2nd, tonight's public hearing, and 2 more additional small business conversation in the next few weeks. We know that there are negative health impacts of smoking and that flavored tobacco plays a role in that. And from Columbus Public Health data, we know that there is an extreme saturation of tobacco retail licenses within the city limits. But we also understand that this proposed legislation from Columbus Public Health could impact businesses. And so it's also important to note that part of this discussion and this potential regulation is also unpacking what it means to declare racism a public health crisis, and the acknowledgement of decades of racially motivated, predatory targeting of harmful tobacco products to Black communities. In 2018, there were about 160,000 residents who smoked in Columbus, and 100,000 of the 160,000 of those residents were Black. That is 1/3 of the Black population in Columbus. 60,000 of those Black users use menthol and mint-flavored products. I do want to make it clear that this proposed regulation will not criminalize or penalize individual behavior. It will focus on civil enforcement of the retail sale of flavored tobacco products. Tonight, like before, we will have a short program, and after that, we will open it up for our folks to provide public testimony. I will call names from our speaker list, and you will have 3 minutes to speak at the podium up front here. Again, thank you for being here with us this evening and for allowing us to have this space to learn together and to elevate this important issue. With that, I will turn it over to Council President Shannon Hardin.
Thank you, Councilmember Favor. Thank you for your leadership as we have this important conversation. And thank you and welcome to all of our guests this evening. You're in City Hall. We call it the People's House. And if this building is the People's House, and this room, these 4 walls that you're sitting within, is the people's living room. It's where we come together as a community of 915,000 people to have discussions, to talk about the most pressing issues, the most challenging conversations. We come to this room to have them. It is a democratic space, which means that we listen to everybody. Everyone's voice will be heard in this room. but we do so with decorum. We engage honestly and openly, and then we deliberate, and then we have conversations. This council, when you lead a community, you can't always expect that everybody will like the outcome of your decision. But what we work really hard to ensure is that you respect our process, that you know that you were heard, that you know that you were given consideration. And so my appreciation does go out to Councilmember Favor, Chair Favor, to the council team, to Councilmember Bankston in his role as chair of the Small and Minority Business Committee, to make sure that we are doing the listening. We're going to do more of that tonight. But as Councilmember Favor said, there's even more after this. And so we are in the middle of a process. We look forward. We are getting your emails, folks, both from folks who want us to do something and folks who would rather us not do this or do other things or have other conversations. But we are hearing you. We're hearing from everybody, and that is our promise. And at the end of this, it is my hope that regardless of where you have been throughout this process in terms of your deliberations or your advocacy, you will say that this was a fair process. With that, I'll turn it back over to Chair Favor.
Thank you, Council President Harden, and please allow me the opportunity to introduce my other colleague, Councilmember Emmanuel Remy, who's also joined us. Councilmember Bankston, do you have any comments you'd like to make? Councilmember Remy? All right, well, with that, we'll move on. Our first presenter this evening will be our Health Commissioner, Dr. Mashika Roberts. And Dr. Roberts, before you get started into your formal presentation, point of privilege here, I know that the Public Health Department just issued a press release regarding a measles outbreak at a local child care facility in the city of Columbus. And while we're here talking about health equity, it would behoove us not to uplift this very important topic, if you don't mind talking about that as well.
Sure. Thank you so much, Chair Favor, Council President Harden, and Council Members Remy and Bankston. I'm happy to share this afternoon, Columbus Public Health, along with Franklin County Public Health, issued a press release about a measles outbreak that we are having at one of our local daycare centers here in town. All of the cases associated with that daycare center are unvaccinated. They are all under the age of 4. And at this point in time, they are all doing well health-wise. I will say one was hospitalized and was pretty sick for a period of time. We bring this outbreak to everyone's attention because measles is a vaccine-preventable disease. There is a vaccine called MMR, measles, mumps, and rubella, that most children should get their first dose at the age of 12 months. There are many in our community that choose not to follow those recommendations by the Centers for Disease Control and the American Academy of Pediatrics. So we unfortunately here in Franklin County have had 8 cases of measles in 2022 since June of this year. The first 4 cases were all, again, unvaccinated children, but had all traveled to measles endemic countries prior to getting diagnosed. These last 4 have no travel history, but they all attend the same daycare center. So we are working with the daycare center. They are cooperative. They have closed at this point in time and are expected to be closed for the rest of the incubation period, which is 21 days. So I would just remind everyone, if you're not vaccinated against measles, whether you're a child or an adult, please get vaccinated. It's a 2-dose series for adults, and you get both doses, 1 dose, and then 28 days later you get your 2nd dose. And those vaccines are available at Columbus Public Health, Franklin County Public Health, as well as your local healthcare provider. So again, thank you all for convening this meeting this evening to talk about a very important topic for our community and for health equity. So Council President Harden, Councilmember Favor, we appreciate you working with public health to help us prevent health damage and disparities caused by flavored tobacco. Banning menthol and mint-flavored tobacco products is a matter of health equity and addressing one of the greatest historical causes that has made racism a public health crisis. Local legislation will improve the health of Black and brown residents while also addressing the vaping epidemic preying on our kids. Legislative interventions on flavored tobacco are important because flavors are targeted and used to hook kids and minority communities on tobacco. We know it. It's been proven. The tobacco industry has been doing it for decades. The statistics are alarming. 1 in 4 Columbus adults smoke. 1 in 4. 39% of all adult Columbus smokers are Black. And nationally, the 2019 data shows that 85% of Black smokers use menthol cigarettes. 85%. The bottom line is socially vulnerable people get hooked on flavored tobacco, and it puts them on a path to addiction and the lifelong health consequences that go with it. The health and economic toll is great. Recently, the Health Policy Institute of Ohio calculated that the total annual healthcare cost of cigarette smoking just in the state of Ohio is $6.8 billion. We have an opportunity right now to change this trajectory through legislative interventions on flavored tobacco in the city of Columbus. Columbus Public Health will continue to work with you and your colleagues to decrease the disparities in smoking so that we can help achieve optimal health for all of our residents and our community, no matter the color of their skin. Thank you so much.
Thank you, Dr. Roberts. Do any of my colleagues have any questions for Dr. Roberts? You know, Dr. Roberts, one sentiment that we've been hearing in our conversations with residents is that there are a lot of public health crises, if you will, that are plaguing our Black and brown residents in Columbus and across this country. Why this issue? Why is this one something that City Council needs to pay attention to?
Well, if you look at the use of tobacco and you look how Black and brown people disproportionately use tobacco products, and then you look at the health of our Black and brown community and what they die from, they often die from cardiac disease, which is accelerated by tobacco use. And that can be high blood pressure, that can be congestive heart failure, it can be a variety of things that many of us are familiar with. You also know that many of them have COPD or asthma. Obviously, tobacco use can exacerbate that. But I think the bigger issue is how we know the tobacco industry has intentionally targeted Black and brown communities to find a product that's easily smoked, smooth, tastes good, and that people can get addicted to very quickly. And that was intentional, is concerning. And if we as a city, and if I as a health commissioner can do something to limit the access to that drug, in my opinion, it's a drug, but of that product, we should be doing that to help improve the health of our community.
So, you know, as many of our residents know, Tobacco 21 went into effect not too long ago, but we had conversations on a legislative level several years before that. Is that not enough? If we're concerned about tobacco getting in the hands of our young folks and folks that are potentially at greater risk of succumbing to some of those issues that are directly related to tobacco use, is education and cessation programs not enough in the city of Columbus?
Well, so Tobacco 21 is a great program. I'm very grateful that we have it here in the city of Columbus. But unfortunately, we don't get 100% compliance with all of our businesses. So our youth under the age of 21 are still able to buy tobacco, flavored tobacco. Our compliance rate in the city of Columbus is just about 70%. So it's not 100%. So that is a concern. And we work with businesses, we provide education with the businesses, but many of our businesses are still selling to our youth. But again, I would argue that this is a product that we know is not healthy to our community, and particularly the Black and brown community. And when you look at the maps, and I think we're going to see some here in a second, you see how the tobacco retailers are disproportionately located in low-income communities and communities with a high percentage of Black and brown individuals. That is not done by mistake. And so we need to reverse that by limiting the sale here in the city of Columbus.
Thank you. And the last question that I have, another sentiment that has come up several times over the last few weeks is that vaping more or less has saved my life, that it has helped curb my addiction to cigarettes and tobacco. And there's a difference between flavored products and vaping. Number one, the first question is vaping a healthy alternative? And then two, what is the difference, if there is a difference between those two?
So I think the best way to answer both of those questions is to say that the FDA has not approved vaping as a smoking cessation product. But more importantly, the FDA asked the vape industry to submit data so that it could be at least investigated by FDA as a smoking cessation product. And none of those companies, zero, submitted any data to the FDA to get it approved as a smoking cessation product. They could have done that. They had that choice. It was offered to them by the FDA, and they did not do that. That should be very telling to people that the companies chose not to submit the appropriate paperwork to get it approved as a smoking cessation product.
Thank you. Any questions for my colleagues? Okay. Next, we have Assistant Health Commissioner Edward Johnson, who is going to discuss in greater detail the proposed legislation.
Thank you, Chair Favor. Thank you, President Hardin, and members of council. Very simply put, and we discussed this. Better? No? Very simply, last week we were able to touch on the fact that at columbus.gov/tobacco, a proposed ordinance was made available to the public. And last week we were able to share that that action would essentially define flavored tobacco in the city of Columbus. It would prohibit the sale thereof, and then it would authorize the Board of Health to promulgate rules to affect that policy. So what we wanted to share was, after having some discussions, after taking a look at the ordinance and then looking back to the community conversations that you hosted, Chair Favor, the Board of Health would adopt that definition if passed by council. It would enforce that prohibition similarly to how it's done with Tobacco 21. After listening to the small business conversation, we heard that there was this desire for additional enforcement to get bad actors out of the market. In order to do that, the Board of Health would propose raising that retail license fee from $150 to $350 to help with that additional enforcement, because we heard very loud and clear, good retailers don't want bad retailers selling tobacco to young people or otherwise. In addition, we also heard from the small businesses and being responsive to them that they wanted enhanced enforcement on that civil penalty range. Currently, our tobacco regulations allow us to issue a $500 fine and then a $1,000 fine for the second and all subsequent fines. The Board of Health, after listening to small businesses, would say, let's increase the first fine to $1,000. Let's have a second penalty of $2,500 and a third penalty of $5,000 and loss of license for the remainder of the existing cycle and the next licensing cycle. This was after listening to those small businesses say it needs to be brought in line with liquor, where there are consequences when you break the rules. And so this is something that could be responsive from the Board of Health end of thing on things on rules that would help us get to a better place regarding bad retailers selling to underage individuals. And thank you, Chair.
Can we leave that slide up? Oh, sorry. Okay, thank you. Thank you, Mr. Johnson, for that presentation. I also want to acknowledge we heard from the folks who attended the small business conversation last week that there was a concern that minds had already been made up. And I think that the changes that have already been made in just short of a week definitely demonstrate that we are listening to our residents, we are listening to business owners, and what was made loud and clear was that there was the need to have greater enforcement and greater penalties for those bad actors that are not playing properly in the sandbox. That the folks who have been attending, and we are greatly appreciative of those small business owners who are taking time out of their day to engage in conversations with members of council. And so this does demonstrate that we are hearing you all and amending how we are viewing these policies in real time. So thank you for that. Let me stop there and allow my colleagues to jump in with any questions, comments, or concerns. Councilmember Bankston.
Do we have, and just so we can have it on the record, what the definition of flavored tobacco would be that we're looking at, or is this saying that we would have to craft that after passage?
And so, Councilmember Bankston, that would be in the ordinance passed by council, which is currently posted on the website as well. And so the Board of Health would simply say, council has defined flavored tobacco, and we've provided a draft that has that language in it. It does include flavors, whether fruit flavors, savory flavors, including mint and menthol. Yes. Yes. Do you want me to repeat that? Perfect. Councilmember, that definition would be contained in the council ordinance, and that is a definition that the Board of Health would then take as the definition of flavored tobacco. And so that is part of the draft, and that is available for the public to see on columbus.gov/tobacco.
Got it. And so that's something that still is crafted. So I just want to set the stage that there's a process here, and we're still listening to the community. The other question I have for you, and maybe Dr. Roberts, you can chime in as well. You know, with our current enforcement only being at, or compliance being at 70%, you know, with this being a massive new undertaking, you know, what does that look like from an enforcement standpoint at the health department? And are we prepared, and do we have the resources ready to enforce this? Because if I read these fines correctly, this is what people will get, folks will get fined if they are still selling tobacco, right? And again, we're not able to be all places at all times. So can you just talk a little bit about that enforcement piece and what would be necessary for us to have full compliance?
Absolutely. So under the current Tobacco 21 provision, we have a team of environmental health specialists that partner with under 21 buyers in the city. And these under 21s are part-time employees of the health department. And so we send them out to do these buys to check compliance. Should this change, part of that would be additional enforcement. So we would be asking to bring on maybe an additional 1 or 2 individuals that would help us route and do the buys in a more efficient fashion as well. So we are preparing in the event that we want to do this enhanced enforcement that I think small businesses, the responsible small businesses, are requesting.
Thank you, Chair.
So when we get down to the third strike, for lack of a better terminology here, the 5,000 and loss of license for remainder of licensing cycle and next cycle, can you give us an example of what that looks like for a business owner who has just had their third violation? Certainly.
So with the violation structure, under this proposal, if you hit your third violation within the 2-year look-back period, we can say that happened with 1 month left on your look back, licensing period. You would lose it for that 1 month and then the next licensing period or look back cycle of 2 years as well. So in total, it would be 2 years and 1 month
Okay.
that you would not have your license. And we thought that that was a sufficient deterrent to say, let's not get to 3 strikes, because every responsible business owner at these conversations said, we don't sell, and this is that mechanism we think to get those bad actors that are selling to under 21 out of the game.
Okay. And then also acknowledging that we're seeing an increase from the current cost of the retail license at $150 to $350. Is that on par with our other municipalities in the state of Ohio?
Chair Favor, it is not on par with our peers. Most peers that are introducing tobacco retail licenses in Ohio and in the Midwest are introducing at the $500 level,
Okay. So considerably
considerably less.
Okay. And welcome to President Pro Tem Brown, who has just joined us as well. All right. Next, we have a presentation from the Chief Health Equity Officer at OSU Wexner Medical Center, Dr. Chike Dubiny.
Thank you for the invitation to speak at this hearing. I'm Chike Dubiny. I'm the Chief Health Equity Officer for the Wexner Medical Center at OSU, Ohio State University. I'm also a professor of family medicine and the family and community medicine at the Ohio State University, and serve in a role at the James Cancer Center Hospital. I just also want to say that I'm a researcher as well. I do work in the area of cancer screening and cancer detection, which includes lung cancer and colorectal cancer, and I've served in national groups looking at guidelines and prevention of illnesses, including cancer and cardiovascular disease. It is very clear, maybe before I start, I will say that I represent the Wexner Medical Center, but it's really very clear that tobacco is one of the most preventable causes of premature death in this country. What is also very clear is that tobacco disproportionately affects African American men in particular, who have a higher rate of lung cancer death in this country that's preventable. Lung cancer is just an example. There are many other areas in which tobacco, cardiovascular disease, asthma in children, sudden infant death, that tobacco has a very negative impact on the health of people. I think for me, the key thing as a researcher and a physician and a health equity officer is that this is clearly an equity issue. The sale of menthol-flavored tobacco in black neighborhoods or brown neighborhoods targets people in ways that put them at risk for addiction. The studies we've done clearly demonstrate that all you have to do is take a whiff of cigarette and you get hooked on it. That could mean a lifetime of smoking and to the risk of tobacco. I also want to speak a little bit to the issue of electronic delivery systems for nicotine. Nicotine itself is the ingredient in tobacco that makes people addicted to it or hooked on it. And that is a vehicle through which you are potentially subjected to a lifetime of smoking cigarette. And even if you don't smoke cigarette at first, the use of nicotine has been shown to increase the likelihood that youth will take up smoking. But also, as Dr. Roberts spoke to, many of the contents of the liquid that are used in e-cigarettes have potential health risks. It is not a safe thing to use in general. So I just want to end by saying that the Wexner Medical Center supports this proposed ban purely on public health and health equity grounds. Thank you.
Thank you. Members, do you have any questions? Yes.
So this goes to you, Dr. Roberts, could be either one. What does it take to quit smoking? Because when I hear of a ban and I think about a ban, I question, tomorrow you can't buy your cigarettes. I want to understand what it takes to quit smoking from your professional opinion.
Well, thank you, Councilmember Remy, for that question. And I think that's a difficult question to answer because it depends on the individual. Obviously, there are several smoking cessation products out there. There are transitional things people can do, from chewing tobacco-flavored gum or chewing regular gum. There's medication people can take. But oftentimes, when we talk to individuals who have stopped smoking and been successful, it was their inner desire to stop smoking, and they stopped cold turkey. So I think that really depends on the individual, how they want to handle it and how bad they want to stop smoking. But there are smoking cessation products out there. There's smoking cessation counseling available. I would say it's no different than when someone needs to lose weight. There's different approaches and how people want to address that.
Next, we have a presentation by Chris McGill, the Economic Development Director with ICE Miller. And I believe he's joining us virtually.
Thank you. Can everybody hear me okay?
Yes, we can hear you.
Okay, great. Well, thank you for the invitation to speak this evening. I have COVID, so I apologize I can't be there in person. My name is Chris McGill. I'm the Economic Development Director for ICE Miller. I'm certified in data analytics and economic measurement, so I work in data regularly for a number of policy decisions and implications and considerations. I'm going to share my screen and show a PowerPoint. And can everybody see the screen okay?
We can see that.
Thank you. Okay, so what I'm going to present to you is a visual illustration of a couple key points. One is there is a high concentration of tobacco retailers near schools. Two, there is a high concentration of tobacco retailers in areas of low income. Three, there's a high concentration of tobacco retailers in Black communities. And four, there's a high concentration of tobacco retailers where there are poor health outcomes. And I'm going to present some visualizations to show that. This first table represents density of retailers in certain neighborhoods. On the left side, you've got the far left column, you've got a sample of Columbus neighborhoods. You have the number of tobacco retailers in each neighborhood. You have the size, the geographic size in square miles of that neighborhood. And probably the two most important columns, the number of tobacco retailers per square mile and the household income. And what we had done is we had shaded where there are areas of high concentrations of tobacco retailers in neighborhoods. You will see that in red. Where there are low concentrations of retailers, you'll see in green. You'll also see high incomes for the neighborhood in green. And if the neighborhood has lower incomes, it's in red. And you can see the color correlation between high concentrations of tobacco retailers and lower incomes. We also just did a simple yes/no column here to illustrate areas with a Black population of 25% or more, which is actually higher than what would be considered a Black neighborhood when you look at the data citywide, just to illustrate that there are higher concentrations in Black neighborhoods as you go down sort of the neighborhood list here. This map illustrates tobacco retailer concentrations in red dots and K through 12 schools, which are in green dots. As you can see, there's a heavy overlap of tobacco retailers and schools. This next slide illustrates low-income neighborhoods. So you have two color shadings. You have dark purple, which represents the lowest income neighborhoods in the city, and a very, very light shaded purple, which represents the highest income neighborhoods in the city. What you'll notice here, and again, red dots are the tobacco retailers. What you'll notice here is the red dots closely follow the dark purple, lower income neighborhoods. You'll also see that in some of the lighter shades of purple, the lightest, the highest income neighborhoods, you've got a very, very low concentration of tobacco retailers. This next map illustrates black neighborhoods. So in the darkest purple, that represents 25% or more black population. And again, red dots, which represent the tobacco retailers. And you can follow the same pattern. For reference, there's a tail that cuts in the middle, which is High Street. So you're always going to have a high number of retailers on commercial corridors like High. So that might skew the data a little bit. But you can see largely the retailers kind of make this inverted L that follows black neighborhood concentration. So I'm gonna just quickly touch on some health outcomes. So again, we're following the dark purple here, which represents the highest asthma neighborhoods. So neighborhoods with the highest concentration of people with asthma. And you can see the tobacco retailer dots follow the dark purple very closely. This next map represents heart disease. Not as much dark purple here, but you see the same trend where where you do have dark purple, you have heavy concentrations of tobacco retailers. Here is COPD, same theme. The dark purple, you've got the inverted L here, and then you've got some more higher concentrations of tobacco retailers to the south. And then diabetes. So again, same theme, darker purple represents higher level of diabetes. So to sum up sort of the health outcome slides, what you'll see is a high correlation of tobacco retailers and negative health outcomes in the city. The next set of maps, we did some zooming into areas to show proximity to schools. So you saw the large overhead view of all schools in the city. We wanted to zoom in on a couple areas where we noticed higher concentration of retailers located near schools. This first map is the Near East Side, and you've got Champion Middle School right here in green. The white dots represent the center of the circle, and then the red triangles represent the tobacco retailers. Here you have 8 retailers within a quarter of a mile of Champion Middle School. Again, heavy concentration in this area. What I've also done is layered in some household incomes for census tracts that constitute the circle, just so you can have a sense of what the incomes of the area are. Here you've got Sullivan Avenue on the west side, and this is Wedgwood Middle School and Eakin here around the middle, and you've got 9 retailers within a half mile of these 2 elementary schools. Here on the south side, we have South High School, 13 retailers within a half mile of South High School here. The image on the right is Johnson Park Middle School. So as you can see, this is again on the east side, and you've got 7 retailers within a half mile of Johnson Park Middle School and various other schools in the area. Here's Columbus North, and you've got, again, a heavy concentration of retailers around Columbus North International School. And then we have Linden. In Linden, we have 5 retailers within a half mile of Medina Middle School. What's very interesting is retail is typically put in place to serve a population. You normally see retailers make location decisions based on spending potential of the area. A lot of these areas have very low spending potential. However, a high concentration of retailers, which is sort of the opposite of what you would expect when making a retail decision. Here is Southside Moeller Elementary School, 10 retailers within a half mile. And then Wineland Park, we have 19 retailers within a half mile. And this is, for frame of reference, this is South Campus. So you've got High Street running here on the west. We use concentric circles here. There's a West Broad Elementary and Highland Elementary School, and you have collectively within this radius or radii 17 retailers in close proximity of West Broad Elementary and Highland Elementary. just the source of the data. So to conclude, and then I'll turn it back over, you've got a high concentration of retailers near schools, particularly middle school, elementary school. You've got a high concentration of retailers in low-income neighborhoods. You have a high concentration of retailers in Black neighborhoods and a high concentration of retailers in neighborhoods with poor health outcomes relative to the city. That is all I have. I will turn it back over to you, Councilmember Favor. Thank you.
Thank you, Chris, and wishing you a speedy recovery. So this question I'm just posing to any of our health experts that have already spoken. But one thing that we heard last week is that the systemic issues that led to these poor health outcomes that were just outlined, that Chris outlined, asthma, heart disease, COPD, diabetes, is no longer a problem because it's 2022. But I can't help, when I look at those maps, not also see our redlining maps for the city of Columbus and how we talk about the reality of overlaying these health inequities, regardless of what you're talking about, if it's asthma, if it's heart disease, and overlaying where those concentrations are. And it mirrors almost exactly with the redlining maps of Columbus. So I guess my question is, why are tobacco retailers still concentrated in low-income communities if this really isn't a health equity issue?
Well, thank you for the question. I would say it is a health equity issue, and you're right. The maps are indicative of what we've seen in redlining, and it's the same map, the same concentration that we see with high unemployment rates, low graduation rates, high infant mortality rates, high crime rates, housing challenges, transportation challenges. It's all bundled up into the social determinants of health. And you can argue that many generations ago, this was intentionally done to Black and brown individuals to limit their access to many resources, and it has hurt their health ever since. We know in those same neighborhoods, when you see the concentration, that the life expectancy of individuals who live in those neighborhoods is much lower than the life expectancy of someone who lives in Upper Arlington, New Albany, or even Clintonville, for that matter. And that has to do with place matters. And so I feel like these tobacco retailers intentionally place themselves in these locations because they know they can make money off of the individuals who live in those neighborhoods.
Yeah. Do any of my colleagues have any questions or comments there? Yes.
It's more of a statement than a question, but following that same line of thinking, the causality between the maps, the selling of harmful products, nicotine, and all the health aspects, there's also what is not being sold, like food or healthy food options and other things. So as we think about like a healthy community, I think we as council, as a community, have to think about what's good to be there and maybe what's good not to be there as well. Like we can have both of these conversations at the same time.
Absolutely, absolutely. And we know, that not many, if not all of these neighborhoods are what we call food deserts. And sometimes the retailers that sell tobacco are also selling other food products that the community needs. I think they could trade off some of those tobacco products for some healthier options that our community could benefit from as well.
No, please.
I just had it's not necessarily related to this, it was back to the cessation conversation, because following Councilmember Remy's questioning, I'll just say this, I do not believe banning a substance that someone's addicted to is the stop for that substance, that cessation is critical in helping someone break an addiction, which is chemical, or, it's there, is the important component. How do we talk about how we could be more effective in helping folks get outreach. And the reason what triggered it is, as you talked about things that folks could offer in stores, the one things that you don't see as much, or maybe not as prominent, are cessation products to actually get folks off of. How do we think through, and how should this council think through better supporting folks who want to quit smoking as we consider this broader conversation?
Yeah, so I know, Council President Harden, you and I have had these conversations, and you have conveyed to me your concern that we as a community do not have all the smoking cessation tools in place that we need. And I agree that there's more we can do. I think there's a variety of different things that we could look at as the health department, as city council, and as administration that we could help with our residents who really want to quit smoking. I think, and I don't want to let the cat out the bag too early, but we had great success with our Vax for Cash program. So is that something that we could model something similar to that with smoking cessation, where we help pay for their smoking cessation products and then incentivize them? We do have a Moms Quit for Two program, so we have a model of that we do in our Women's Health and Wellness Clinic, where we help pregnant women and their partners stop smoking while they're pregnant and beyond, and it's very successful. So it's coaching and it's incentivizing them with diapers so that they will stop smoking, and it's true confession, it's testing them to see if they are being compliant with their cessation. So I think there are a variety of things we can look at that can be creative to help our residents who want to stop smoking.
Yes, President Pro Tem Brown.
Thank you, Chair. I don't mean this to sound cute because it's actually deadly serious, but we're talking about cessation, and it is very hard to untangle someone's addiction to these products because they are so addictive, which to me only screams that the best way to go after cessation is to stop the sale. This is really generational work. I mean, Councilmember Favor, you were talking about the generational policies that led to those maps that Chris McGill told us. So yeah, that's far off thinking, and we do have to think about cessation for the here and now, but far off thinking is required in public policy making, and that's how we got here in the first place, is seeds that were planted to addict generations. So if we're going to reverse that, we've got to plant the seeds to not allow generations to be addicted, to prevent generations. So I don't mean to, again, that feels a little bit maybe simple, but I just think it's true that the best way to stop a smoking addiction is to get in front of ever needing the cessation.
Thank you, President Pro Tem, because my thought here is that, we can't view this problem in isolation, that it's only a small business economic issue or purely a health equity issue without understanding the role and eliminating the remnants of systemic racism in our community. We just can't, the two are interchanged. And we hear our residents and our responsible small business owners, but I wholeheartedly believe that we all have a role to play in eradicating systemic racism in our community. And us acknowledging the negative health impacts associated with smoking and the targeting, the intentional actions on behalf of, in this instance, big tobacco, to Black and brown communities, we cannot afford to also acknowledge that as well. And one does not diminish the other. You can be a small business owner and also recognize that this is also a problem in the community. And so how can we work collectively to acknowledge and address the issue. I don't have the answer to that question just yet, but I want to raise that here tonight because we have heard quite a bit the diminishing of this as not being truly a public health crisis. And I think what we have seen just through the data alone, in my opinion, does quite candidly demonstrate that, like many issues that we are currently working through in the city of Columbus, are these old measures that were put into place that continue to show up, that continue to have negative health impacts, that continue to put people in danger, that continue to ensure that people don't have access to safe and affordable housing, and the list could go on and on. So I just want to make sure that that's being said, that we don't have to diminish one thing in order to uplift another, that two things can both be true at the same time. So I hope that that sets the tone for how we have our as we move into the public testimony portion of tonight's conversation. Before we do so, members, do you have any additional? Yes, Councilmember.
I did just have one last health-related question, because all the data that we've been seeing so far is about smoking. Do we have also data on other forms of flavored tobacco, so dips and chewing tobacco as well?
Chair Favor, Councilmember Bankston, when we provide those numbers, that is tobacco usage, and we would colloquially call those smokers.
All right, we are going to move into the public testimony portion of tonight's public hearing. Just a reminder that everyone has 3 minutes to present their testimony. If this is your first time at council, welcome. After the conclusion of your 3 minutes, there will be a nice ding that will sound, letting you know that your time has concluded. We have 50 speakers tonight. Y'all got 3 minutes. With that, we'll move forward with our first one, Dr. Nicholas, and I apologize, Christalis. And I'm going to cue everybody up so they know who is next. We have Dr. Laura Espibel, and then after that, Dr. Joshua Joseph. Welcome to council. How bad did I mess up? Oh, I wasn't going to get that. I apologize. I apologize. Welcome.
Dr. Nick is good. First time in council chambers, so we can start the clock. All right. Again, hello, my name is Dr. Nick Kriatsoulis. I'm the Chief Clinical Officer for the Mount Carmel Health System. I'm an emergency medicine boarded physician as well as a palliative medicine and hospice physician. I'm here today to speak to you about the medical impact of tobacco use, especially the impact on our children. We all know that smoking and tobacco is not good for you. Countless studies over the decades have proven this to be an indisputable fact. According to the National Center for Chronic Disease Prevention and Health Promotion, tobacco use increases your risk of coronary artery disease, it doubles your risk of stroke, 25-time increase in cancer-related deaths. It also increases chronic obstructive lung disease, which we see all the time in a hospital. It causes diminished overall health and increases the utilization of cost of our overall health care. Tobacco use is related to nearly 1 in 5 deaths in the U.S. and remains one of the leading causes of preventable deaths in our country. Tobacco use is particularly devastating for our children's health. According to the National Institutes of Health, at current rates, 5.6 million U.S. residents who are now 18 years or older will die prematurely from smoking-related diseases like the ones I just mentioned. Nicotine exposure during adolescence negatively impacts brain development, leading to impaired cognition and behavioral issues. Numerous reports suggest that adolescent smokers have an elevated risk of developing cognitive impairment and psychiatric disorders later in life. The adolescent brain is also more sensitive to the pharmacologic properties of nicotine, causing teenagers to develop nicotine dependence more easily than adults. Exposure to tobacco smoke also results in disrupted lung development and reduced lung function in children. There is no smoke or tar involved with vaping, but there are small amounts of chemical flavorings, including diacetyl, propylene glycol, and even formaldehyde when the unit overheats, the liquid overheats. No one knows the long-term side effects of vaping, but several vaping products have been linked to serious health problems, including severe lung injuries, seizures, nicotine addiction, which we're well aware of, and increased heart attacks and strokes. A 2019 study published in the Journal of the American Medical Association found that the young people who vaped had 4 times the odds of going on to smoke traditional cigarettes compared to their non-vaping peers. The tobacco industry knows that 95% of adult smokers start by age 21. They have a long history of targeting kids with flavored products like bubblegum, cherry dynamite, popcorn, and blueberry ice.
Thank you, sir.
you.
I do have a question for you, though, because
ma'am.
you mentioned young folks, and there was a specific line that you had. Why are we seeing, or why are young folks moving from vaping to cigarettes
So
if it tastes better?
Sure. Nicotine is an addictive substance. The brain continually craves more nicotine. So what the next step in that process would be smoking.
Okay.
Yeah.
Colleagues, do you have any questions for Doctor? Thank you, sir.
Thank you.
Oh, yes. Sir.
Doc, so as we go through this process, it should be a learning process, at least for us as policymakers. And so what I'm trying to understand is is there a difference between, I heard there's a synthetic type of liquid vape. Is that less or more than any other type of nicotine? Like how many different forms is this? I just want to fill out this conversation so that we really understand what we are talking about from folks, hopefully that from the other side.
You know, we know that cigarettes in themselves have 7,000 plus toxins in them, in the tobacco itself. The vaping companies have placed a lot of these chemicals into them for flavor, which in turn causes more issues with chemicals that we just normally don't see in smoking. So when you heat up that vapor, other chemicals are produced. Again, the flavor is something that they're craving and they want with the nicotine, which is an addictive substance, and that just precipitates more want and need for the nicotine itself. And they use the cartridges for other things too. So, yes, thank you.
So, folks, we're going to keep it civil. Dr. Laura Espy Bell. And as a reminder, Dr. Joshua Joseph is next, and then John Rotuno. Welcome back to council.
Good evening, Council President Hardin and all of the council members. Thank you for having me tonight, giving me this opportunity. My name is Dr. Laura Espy Bell. I am an associate medical director and also a board-certified emergency physician here in Columbus. I work primarily on the east side of Columbus, and that was intentional because I promised my parents when I became a physician that I would come back and work in the same community that raised me. So this topic tonight is especially important to me. While we have all witnessed the ravages of tobacco-flavored products, these products pose a unique threat to our residents and more specifically to my patients. Tobacco companies offer flavors for a simple reason: to entice the most vulnerable and the most at-risk members of our community become more addicted to nicotine. Menthol cigarettes are the original flavored tobacco product. The mint taste was a disguise to shadow the harshness of the smoke. The tobacco industry developed menthol cigarettes as a means of a more gentle way of introducing it to new consumers to nicotine, making it harder for them to quit. In the 60s, the tobacco industry began to do a well-documented campaign to market menthol cigarettes to the Black community especially. They did this through targeting, through advertising to lower prices in Black communities, and also offering free samples to Black communities. So this is no accident that the tobacco claims approximately 45,000 Black lives each year, making it the leading cause of preventable deaths in the African American community. At the same time, e-cigarette use among our children has become an epidemic, reversing decades of decline in tobacco use of kids, in which 81% of our youth who have used a tobacco product initiated tobacco use with a flavored product. Now, several weeks ago, as an emergency physician, I was working a clinical shift and I had the opportunity to care for a middle school child. This 11-year-old boy came in with a cough and wanted me to evaluate him. So after I ruled out all the infectious causes of this cough, he later shared with me that he just started vaping in the 6th grade. So as a mom and as a physician, I can't leave that conversation without some type of intervention. So I ask, why and when did this start? And he said, well, I started doing this because all of my friends were doing it. So in that moment, I realized this was a much bigger issue than we just read about and that we see. This is what I'm seeing in my daily practice in the emergency department. These kids are coming in with coughs from vaping and using e-cigarettes. They are at a higher risk of having COPD, of having asthma, chronic lung disease, recurrent pneumonia, chronic bronchitis, and ultimately acute respiratory failure. So as a physician, let me be extremely clear. Nicotine is extremely dangerous and harmful to our children. It impacts their learning, their attention, and their ability to live a quality life. Thank you.
Thank you, Doctor. Any questions for my colleagues? Thank you. Dr. Joshua Joseph. And as a reminder, John Rotuno, and then Corey Pegas.
Thank you, Council President Hardin and all the council members for the opportunity to speak tonight. My name is Joshua Joseph. I am a scientist as well as a physician here in Columbus, Ohio. I work at the Wexner Medical Center. And, you know, it's been a lot of great data that's been shared tonight. And you probably have all seen me present data before. I love to present data, but I'm not here to present data tonight. The leading cause of preventable death in the United States is smoking. The leading cause. It's not second, it's not third, it's not fourth, it's the leading cause. And we know that when we talk to middle school students and high school students, that they are getting on that path from flavored tobacco, right? And what they're saying is that when you look at 2 out of 3 kids, they're saying that it is the flavor and the tobacco that is leading them to use it. When you look at individuals who smoke who are adults, 50% started on mentholated cigarettes. 50%, 1 in 2 individuals. When we look at a typical Juul pod, it has as much nicotine as 20 cigarettes. Not 5, not 10, not 15, 20 cigarettes. So we know that it is critical to consider a ban on these harmful products. We also know, to your point, that it is hard to stop smoking, right? It is very hard. I had a gentleman in the office yesterday, 60 years old. He started smoking 46 years ago at the age of 14. You know what kind of cigarettes it was? Methylated cigarettes. And he talked about his difficulties with trying to stop smoking. Now for him, he's using Nicorette gum, and he's hasn't had a cigarette in 4 months. But 9 in 10 individuals that I talk to are still smoking and still struggling. And if we want to think about how difficult it is to stop, just think about Barack Obama. He smoked throughout his first term of his presidency. And in that presidency, when he talks about what forced him to stop, he said it was Michelle Obama. Not everyone has Michelle Obama at home, right? And so the easiest way to think about smoking cessation is to not start. And so we have to prevent individuals from starting smoking. The last thing I would like to say is that Smoking has impacted me personally. As many of you know, I went through Columbus City Schools, whether that was on the south side at Stewart, whether that was on the north side at Woodward Park, or whether that was in Linden McKinley at Calls. And at each of those stops along the way, the tobacco advertising was prevalent. You saw the maps earlier today. Tobacco also took both of my grandfathers that I never met, one from cancer and one from heart disease. So I appreciate your time tonight and for giving this opportunity to talk just a little bit about the importance of what we are considering here today in Columbus. Thank you.
Perfectly timed. Any questions from my colleagues? You know, Dr. Joseph, you did make a mention to a puff of Juul being equivalent to 20 puffs.
A pod.
A
So
pod.
when you look at a pod of Juul, that is equal to 20 cigarettes as far as the amount of nicotine. And what's important about that is when we think about whether you call it vape juice or e-cigarette juice, et cetera, is that juice actually impacts the cardiovascular system too. Our colleagues right here at The Ohio State University Wexner Medical Center have done that research to show that juice actually damages the heart and all the blood vessels as well. So when we think about that increased risk of heart attack, the increased risk of stroke, the premature mortality that we saw in those slides, we know there's about a 20-year gap for many Black communities here in Central Ohio. This all plays a part in those harmful effects that we see.
Thank you. All right. John Rotuno. Welcome to council.
Well, I got a tough act to follow here with all these experts. Was that planned? Hi, thanks for having me. My name's John Rotuno. I'm a retired ATF agent. I had 35 years on the job, gang enforcement agent. I currently teach law enforcement at one of the local junior colleges where I live. And I'm here to say this. I've listened to all the data and all the experts, and I agree with everything they say. And with your ordinance and your law that you're getting ready to either put into effect or not into effect, I just want you to consider these things, and that would be the criminal element. Okay, menthol cigarettes are here, all right? And a lot of the street gangs are using menthol cigarettes to enhance their open-air drug market. I understand there was a press conference here about gun violence. Guns, gangs, drugs, it all comes together, all right? So if you're going to do this, consider what the criminal element's going to do. What do you think they're going to do? Well, they can do a lot of things because they like the money. And selling loosey cigarettes is a money-making enterprise for organized crime, organized groups of criminals and street gangs. And what they'll do is they'll either go to a neighboring state that doesn't have the ordinance or the law, and they'll do smash and grabs there, or what they'll do is they'll get regular cigarettes, dump them into a container, and they'll go on the internet and they'll buy the menthol and spray and making their bootleggers, okay? And that's even a bigger health issue. Or better yet, we'll have Russia, we'll have China, we'll have Mexico, we'll have organized groups of criminals importing this stuff into our country. So I was going to make this brief, and I just want you to consider the criminal element because they're not going to go anywhere. They will adapt, and they will figure it out, and they will make money. They're going to make money one way or the other. Thank you.
Sir. Thank you for your testimony. I think you had just a few seconds left, but when you say they, who are you referring to?
Gangs, when I say they, I talk about the criminal element.
And I know there's been talk about the targeting. My mantra is this, okay? And I did this for 35 years. Who are they? Where are they? What are they doing? And how do I catch them?
Right.
That's what we do.
So, and your testimony this evening is that if this ban were to go in place, they, the folks that you just identified,
Criminal element, right.
the criminal element
Yes, ma'am.
will now pop up?
No, oh, no, I think it's here.
So you think this behavior is already taking place?
Oh, yeah, I think
Okay.
it's here, just like it is everywhere else.
Okay, but you're saying that it's going to increase?
I'm saying consider it,
Okay, gotcha.
consider that.
Yes, President Pro Tem.
So you're concerned about groups of individuals who sell illegal drugs in the first place?
Yes, ma'am.
And you think they will divert their pretty lucrative drug sales into selling
Well, if
loose
it's not
cigarettes
available-
on what kind of a margin? Like, why would
Well,
they
Because
change?
if you're stopping it, if you're cutting it off, if they
Right.
don't have it anymore, what are you going to do? If you're making $100,000 a week on loosies, what are you going to do if this state dries up? What would you do? Because you like the money. You're going to go get it somewhere else, either through Mexico, either through China. You're either going to bootleg them and make them yourselves, or you're going to go to a neighboring state and get it at another venue. Make
Okay.
sense?
No, I hear you. I'll take some time to try to follow the facts that lead to that, rather than the specter of it, the possibility of it. I appreciate you coming down and raising
Well,
it.
thank you. Thank you for having me.
Thank you, sir.
All right.
Up next, we have Kenny Hampton. After, that was loud, I apologize. My apologies. It's Corey Pegas, then we have Kenny Hampton. Corey should have been queued up. Corey, are you here? Okay. Mr. Hampton, you're up. I was going to do a game show reference, but, break the ice a bit. Welcome back to council.
Thank you for having me. Well, good evening, council. It's a pleasure to be here. My name is Kenny R. Hampton, and I'm the Vice President of the African American Male Wellness Agency. One of the focuses of the African American Male Wellness Agency is to close the gap. You may ask yourself, well, what gap is Kenny referring to? And the gap that I'm referring to is the life expectancy gap that exists right now between African American men who die on average at age 67 and white men who die on average at age 79. Many are aware that the lung cancer is the #1 killer in the African American community. African American men have a higher incidence of lung cancer than other racial or ethnic groups, and they have higher death rates from this disease. Banning menthol and flavored tobacco products is a matter of health equity in our community, which is something that at the agency we take very, very seriously. Local legislation will improve the health of Black and brown residents while also addressing the vaping epidemic preying on our children. The life expectancy of our kids is very important to our organization, and menthol and flavored tobacco products are widening the gap that we're actually trying to close. And I'll close with that.
Thank you for your testimony this evening. Any questions or comments by my colleagues? Thank you.
Thank you.
Corey Pegas, trying one more time. All right. Next, we have Leanne Wheeler. Welcome to council.
Thank you so much, Madam Chair. Thank you. Thank you, Council. I'm Leanne Wheeler. I am a product of Columbus South High School Bulldog Country, and I am here this evening in support of any ordinance that you would put forth on the topic of banning flavored tobacco. My earliest memories of my dad's birthday on March 1st is of him trying to quit smoking. He began at 12 years old as a young caddy, which, as it happened, was the only job young Black boys could have. in the 40s and 50s in these United States. It was his annual renewed commitment to stop. His younger brother, an Air Force veteran, as was my dad, and as am I, actually, we are a family of service members, died of non-small cell carcinoma of the lung at the age of 47. His mother died of non-small cell carcinoma of the lung at 77, and until her massive heart attack and subsequent stroke, she smoked Pall Mall Reds. Dad smoked Lucky Strikes. My mother, who just passed in January of this year, smoked Salem's. She died of breast cancer and lung cancer. I cared for her for the last year and a half of her life, and upon entering my childhood home, could not reckon with where the smell of cigarette smoke was coming from. I called out Coit, had them clean the vents. I called out cleaners to do an industrial clean, and would later find a cigarette lighter under her pillow, as she was, like some teens that I can imagine in the 80s, 70s, 80s when I grew up, was sneaking to smoke, even as she had an end-stage diagnosis for cancer. So I'm here in support, as I shared, of legislation to move forward with banning the sale of flavored nicotine, no matter the delivery system, whether that's commercial tobacco, e-cigarettes, or vapes. So I rise in support of that. I just ask that the community and our representative government give this the due diligence. I appreciate that you're creating space, Madam Chair, for this dialogue. The numbers are there, and I'll offer one thing and then take my seat. I see I'm getting close. The federal government instituted the Tobacco Control Act in 2009. We've known since 2009 in this country that the feds were looking at tobacco as an issue. I'm going to assert that if you started a business after that, you did it at a risk. And so with that, I'm complete.
Thank you for your testimony this evening. Up next, we have, and I apologize, Abdullah Chaudhry. And after Mr. Abdullah, Valerie Yeager. Welcome to council, sir.
Hello, and thank you for your time this evening. My name is Abdul Ansar, and my family own and operate 10 stores in Columbus, and that currently employs around 37 people. I'm disappointed to hear that the Columbus City Council is considering a ban on flavored tobacco products, as this will have an overwhelming impact on our business and our community. Flavored products alone make up approximately 45 to 50% of our in-store sales. In addition to tobacco, we also sell fresh food, beverages, and other shelf-stable food products to satisfy the local community. If you pass this legislation, I will be at competitive disadvantage, and my adult customers will go and purchase their preferred products along with their gas, prepared food, and grocery items. We will be forced to raise prices on other products, reduce my employees' hours, and potentially lay off some of my employees. Tobacco is the most regulated product in our stores. All tobacco is behind the counter. We diligently check IDs. The legal age to purchase is 21, and there are fines should we fail a sting. We take this issue very seriously and abide by the current stringent laws and regulations here in Columbus. Prohibition doesn't work. Consumers will simply drive outside the city limits or purchase their products through a black market. I urge you to work with all stakeholders in the community, including the retailers. Talk with us, hear us out. Let's find a solution together. Another thing I want to talk is that we are community stores. We are not just tobacco retailers. We sell all type of products and groceries at our community stores. They said about the stores being in the low-income neighborhoods. Who approved those tobacco licenses? Columbus City did. And in the data mapping that was shown, I didn't see the population density, and this showed that there were retailers, tobacco retailers. They didn't show how dense the other retailer locations were. If there were other retailers over there, it might be a strip mall. Also, Dr. Roberts said that these retailers put themselves to the low-income areas to make money. Let me please correct the doctor that most of these stores have been there for over 30 years or more.
Thank you, sir. Thank you. I do want to take a moment to highlight a point that Mr. Abdullah just made regarding essentially zoning. And this council has been very candid and clear about its intention to update our zoning code. And so when you talk about systemic issues that we are trying to eradicate, part of that is dealing with our own history. And that negative history is associated with zoning. And so that is something that we are reconciling with, engaging with the overhaul of our zoning code in a comprehensive way. So thank you for raising that point, Mr. Abdullah. Dr. Yeager, welcome to City Hall.
Good, thank you. Good evening, Madam Chair and council members. I'm Dr. Valerie Yerger, a founding member of the African American Tobacco Control Leadership Council. I'm also a tobacco documents researcher and professor in health policy at the University of California, San Francisco. I'm also affiliated with the UCSF Comprehensive Cancer Center. The AATCLC is the organization that initiated the lawsuit against the FDA, and we are here to support Columbus in your efforts to bring relief to a social injustice being perpetuated by an industry that has profited from the suffering of communities under siege. Previously, secret documents provide evidence of tobacco industry's predatory marketing of menthol cigarettes and the dumping of these poisonous products in low-income, marginalized communities across this country. The tobacco industry exploits a myriad of social, health, educational, and economic inequities to foster the uptake and use of menthol cigarettes and other flavored tobacco products. These inequities represent intergenerational chronic stressors, including structural racism, that are assaulting populations that are self-medicating to cope with the stress. In terms of the African American population, menthol cigarettes are killing us at a rate unmatched by any other assault in our community. Though constituting only 12% of the total U.S. population, Black America bears an alarming amount of the total menthol-related harm, 41% of the smoking-related premature deaths, and 50% of the life years lost. 1.5 million of our children began smoking and became addicted to nicotine between the years 1980 and 2018. These numbers horrifically show the outcome of decades of predatory, racist corporate activities. Tobacco companies use financial incentives and exchange political favors to diffuse tobacco control efforts stemming from within communities. And they often use individuals and organizations who are very familiar to us to infuse this disinformation about menthol and flavor bans. Let me just say, that there are nearly 360 U.S. jurisdictions that have passed some sort of ordinance banning the sale of flavored tobacco products, including my own state just yesterday, California. Please join us as we save lives. Thank you.
Thank you for your testimony this evening.
Doctor, I did have one question for you, and anecdotal, or if you have a hard data, I'm just interested, because you've been doing this work nationally, what has the economic impact been in some of those cities? And I know that this is fairly early, so we may not have that data just yet, but if you could just speak to how other cities have navigated
I'm sorry.
that.
If you all need to have conversation, we'd ask that you please take it out into the hallway. This room is definitely not conducive to chatter. It really expands in the room, so thank you for that.
I understand your question in terms of the economic impact. So I see two things with that particular question. One is, what is the economic impact on retailers? And so the menthol bans are fairly recent. We are in the process of getting information about it. And yes, their sales may go down, but they have not been going out of business. This is the same fear and argument that we've been hearing for decades. The restaurants, the bars, all the owners were very concerned that they were going to lose their profits. So they go down, but then they come back. But the other piece of this is that we'll save all kinds of billions in terms of healthcare costs, and we can't lose sight of that. And what I have said, and I will continue to say, is that we know that the tobacco industry, the manufacturers themselves, are trying to come up with alternative products. So these products are likely not to even be available. So business plans need to be considered. Alternative products to keep them viable definitely need to be considered. But we are definitely moving in a trend where these products are going to be removed, and not just flavored tobacco, but all tobacco products. And the industry, go in the industry documents, because the industry has for quite a while, known that this is going to be their future, and we're coming up upon it. Thank you.
Thank you. Up next, we have Human Chandri. I apologize. Welcome to council. And up next, Amanda Turner.
Good evening, everyone.
Good evening.
I'm here against this ban, because limiting flavored tobacco in all stores is not, it's going to not solve issues at one hand. Because especially in the zone-wise, because when you guys putting like in zone limits, ban on these small businesses, it simply create like another black market. So people, they can go like 5 minutes down the street, or like they're gonna drive to 1 mile down left or right. So they're gonna buy whatever they want, and they will definitely bring back stuff, and they're gonna sell it like as a black market. And like I said, it's gonna like going to create more crimes in the neighborhood. And whoever is addicted to tobacco, they will find the way, they will get it. And like I just encourage, like city, if they're gonna put the bans, they have to first look at the stores or businesses that was making like violations, already selling tobacco to the underage. So first off, they need to crack down those stores, not store like they are like following the regulations. Like at my store, we have a scanning data. All the tobacco products, it's go under by IDs. So we scan IDs, and then anybody can have that purchase. So last meeting was the question how these vape and tobaccos end up in the innocent, like underage kids, especially. So like in the neighborhood, like a walking distance, kids go outside the stores, they stand up outside looking for the people, like any homeless person. They give them like a couple $2 extra to buy for their beer or something. And then in that case, they buy them back that vape or pack of cigarettes. So especially like they have to go down there and look them to those who is selling these products. Putting ban for like all stores, everybody is gonna kill like other people or other businesses or families and many of them, they're going to out of businesses. Like before that, lady said, we are not going out. We're definitely going out because 70% sales on tobaccos. We have a beverages, like at my store, I have a pizza shop. But now people, they come to that store and they like to buy shop, they like to do shop in one place because people don't have a time. So they go in one place, they buy whatever they need. If they don't gonna find that stuff, definitely they go to the next store. They're not gonna come back to that store. If they need, they just come for like one thing. And like other extra things, not going to buying there because they go there one time, two time. Even we don't have like if we shortage anything, any pack of cigarette or any cigarette they want, they come one time, two time. Third time, they could go cross street, they could next door, they could go to the like 1 mile down, and we never show them back. So like putting a ban, it's gonna affect us, definitely.
Thank you for your testimony, sir. Amanda Turner, and after Amanda Turner, we have Jacob Rich.
Good evening, and thank you for having us tonight. My name is Amanda Turner, and I am the Executive Director of the Preventing Tobacco Addiction Foundation and Tobacco 21. I'm also a member of the Coalition to End Tobacco Targeting, but today I am here in my most important role, and that is as a parent. I am a Columbus City resident. My son goes to Columbus City schools. And we, folks that work in public health, often have a personal story. And mine is I'm from the South, and my grandfather was a tobacco farmer. And unfortunately, he got lung cancer because he was a smoker and died when I was 10. So it's safe to say I've always really disliked tobacco, but as a mother, it is something I fear. You've heard about the many products we're talking about, and I just want to give you a quick demonstration of what I do fear. This is an innovative industry. This is a pack of cigarettes. This is about 20 puffs worth of nicotine. The products I recently purchased, this one's called a Breezy Bar. It comes in lemon mint. It is advertised as 6,000 puffs. So if I'm doing my math correctly, this is equivalent to 30 of these. This cost me $19, and I could just hide it in my hand, and it smells like I'm in a Bath & Body Works shop. What bothered me the most is when I purchased these from a store in Columbus, I was given a free gift with purchase. This product has 5% nicotine. They gave me a free gift with purchase with 6% nicotine. This is a marketing tactic. It's not because they had extra, it's because they can. They legally can give this out for free. They can't give cigarettes out. But these are the products that we're talking about. These products, again, come in lemon mint. I have one here that's a watermelon ice. These are not out there for cessation. They're out there to enhance addiction. So as a resident, as a member of the public health community, we ask that you address this and do something about it, because at the end of the day, if you decide to go forward and end the sale of flavored tobacco and nicotine products, our coalition, we don't profit off of this. We are looking to save lives. If you do nothing, the tobacco industry will continue to profit off of these products and continue to see the increase in deaths from tobacco use. Thank you for your time.
Thank you for your testimony this evening. Jacob Rich. After Jacob Rich, we have Rob Crane.
Chair Faber and the rest of the council, thank you for the opportunity to testify today. My name is Jacob James Rich, and I am a researcher at the Cleveland Clinic Center for Value-Based Care Research, pursuing my PhD at the Case Western Reserve University School of Medicine. I'm also a healthcare analyst at Reason Foundation, a 501c3 nonprofit policy research organization. I write academic research on how to reduce tobacco use and was recently awarded Case Western's Diversity, Equity, Inclusion Award to pursue research that addresses health disparities among marginalized populations. The potential regulation of flavored tobacco in the city of Columbus is designed to reduce tobacco use, particularly among communities of color. Given that rates of lung disease among Black Americans are higher than other populations, even amid lower rates of historic tobacco use, pursuing interventions to reduce smoking rates in this population should be applauded. However, there is not much evidence that comprehensive tobacco flavor bans significantly reduce rates of smoking among adults or youth. And the criminal justice implications of a menthol ban may in fact further exacerbate health disparities in the Black community. Policymakers should be concerned about the differential racial impact of this regulation. Menthol cigarettes are preferred by the black population, so a menthol cigarette ban will overly allow white people to legally smoke their preferred cigarettes, while communities of color will need to either travel outside city limits or source from unlicensed cigarette providers. This could be disastrous, as it may increase police officer confrontations and increase the number of street sellers who are more likely to sell cigarettes to youth. Additionally, in just about every way possible, non-flavored cigarettes cause much more harm in the United States than menthol cigarettes. First, more people smoke non-flavored cigarettes than menthol cigarettes, both adults and youth. Second, people who smoke menthol tend to smoke fewer cigarettes a day. Given these considerations, non-flavored cigarettes are typically the more addictive product. So a true public health approach would prioritize controlling non-flavored cigarettes. And in addition, it's not clear that the regulation will even reduce smoking. On June 1st, 2020, Massachusetts implemented a tobacco flavor ban. I personally authored an analysis that compared cigarette sales in Massachusetts after the ban to the year prior, finding millions of additional cigarette sales in Massachusetts when you combine it with the other bordering states. It is true that menthol cigarettes bans reduce cigarette sales locally. However, if surrounding localities have lower cigarette taxes, just like Massachusetts and Columbus, total cigarette sales actually tend to increase as residents drive across borders and buy cigarette cartons in bulk. In conclusion, flavor bans at the local level have little effect on public health so far, and potentially disastrous consequences for communities of color. Massachusetts has already conducted multiple raids after implementing its flavor ban, mostly in communities of color. I urge the city of Columbus to collaborate with community members to determine an inclusive approach to improving health outcomes among its historically marginalized populations. Thank you for your time and consideration.
Thank you. Thank you, Mr. Rich. And I encourage everyone to submit their testimony to flavoredtobacco@columbus.gov. I would ask, you were going really fast.
I was trying to get as much in there as I could, and it was like literally just.
No, I know. It's a little bit of pressure there. Could you please send your testimony to the Flavored Tobacco
I can,
email
I'll
so we can
include
read
all
it?
the citations for the specific data too.
I appreciate that. Thank you very much. Up next, we have Rob Crane. And after Rob Crane, Julius Jenkins. Welcome back to council.
Madam Chair, members of council, thank you so much for having me this evening. My name is Rob Crane. I'm a family physician, former professor of family medicine at Ohio State. I'm also the board chair and founder of Tobacco 21 and the Preventing Tobacco Addiction Foundation. But today I'm just here as an historian. In 2004, we came before you representing Smoke-Free Columbus and a very controversial issue, that is getting rid of indoor smoking and protecting the lives of those workers in those places. Through many hours of testimony into 2:30 in the morning, we heard restaurant owners project that they would lose half their employees. We heard bar owners and bowling alley owners say that they would have to close because half of their clientele smoked. Our employees, they said, will go on welfare and food stamps. I'll lose my mortgage. But council held firm. And a dozen surrounding communities did likewise. 2 years later, the entire state of Ohio went smoke-free when the voters of the state used our very same language. In 2016, we came back facing a terrifying national epidemic of youth nicotine use. We asked council to consider raising the age of sale to 21 for these very addictive products. The convenience store owners and the vape shop owners said, old enough to fight, old enough to smoke. And we will have to lay off employees. We'll go under. Our message was simple. The science showed that 18 to 20-year-olds were the major suppliers to teens, and that 95% of smokers began smoking before age 21. We asked only, can you please lay off our teens? You really have one time to grow up. Well, council held firm, again supported by the majority of surrounding communities. And 2 years after Columbus went, the state legislature took the entire state to 21. Now we're back. We do not asked you to get rid of cigarettes or e-cigarettes or small cigars or hookah or spit tobacco. Only, please, can you take the candy out, the candy that entices our kids. Columbus has led before, and many of our suburban neighbors are ready to act along with you. We ask only, can you please take the candy out? Thank you.
Thank you for your testimony this evening. Thank you, sir. No questions. Up next, we have Julius Jenkins. After Mr. Jenkins, we have Latasha Tyree. Welcome to council.
Hello. I'm in support of the ban, but after hearing things tonight, I don't think I can go into like everything I was going to say because pretty much everything I've said, I'm going to say, has already been said. I am a high school junior. I live on the east side of Columbus, and the impact that flavored tobacco has had on my community itself has been detrimental, especially since before me, my family, including my grandparents and aunts and uncles, have all smoked, and some still are in the process of smoking flavored tobacco products. My main concern with this is that more kids like me and people of my, I think that, I want to say that I think that this ban will help delay the, I think that this ban will help drive the need for, I think this ban will help stray the need for my students, my coworkers, and peers to stop using flavored tobacco products. Thank you.
Thank you, Mr. Jenkins. Latasha Tyree? Latasha Tyree? Paul Crozier? Is there a Paul Crozier or Latasha Tyree? Michael Coleman, which sounds weird calling you that. Welcome back to council.
Chairwoman Favor, Councilmember Remy, other members of council, the public, it's a pleasure to be here this evening. I'll try to make it short because it is a long night, and I do appreciate you taking the time and effort to consider this important ordinance. I'm an attorney, a partner at the law firm of Weiss Mueller, and I represent tobacco-free kids. And I really just want to respond to some of the comments I heard earlier and some of your comments, Council Member. Today I cut through the Coleman building to get over here. And on the lobby of that building was a display of redlining, a very clear discussion in that display of how redlining has impacted Black communities, low-income communities, how redlining has been used to keep banking, financing, insurance, housing, and other things out of the Black community and poor communities in the city of Columbus and around the nation. This is the new redlining, in that rather than ensuring a lack of investment of those kinds of things, there's a great deal of investment of flavored tobacco products that cause cancer and death and disparate health outcomes to the Black community. This is the new civil rights, and this is the new fight against redlining in that community. I also want just to make a point that this issue of crime, that somehow this is going to increase gangs and crimes and and increase it's a fear tactic on this issue. And here's why. Because this is not a criminal ordinance. This is a civil ordinance. There is a fine. It is not a crime. It's a big difference. So if they find a way to sell this, they'll be fined. But it is not a crime to possess. It is not a crime to use. It is not a crime to buy these flavored tobacco products. It is a licensing procedure of the health department. It is not a crime. It is a fine. And the final thing is, this is an epidemic in our Columbus Public School District. It's a problem. And you'll hear from teachers, administrators, and even the school board how much of a problem this is in our schools. Thank you.
Thank you, Mr. Coleman. Up next, we have Dustin Hoffinger and the Honorable Senator Charlita Tavares following. Welcome to council.
Madam Chair, thank you. Like many others that have come up here tonight, those comments that I had prepared have already been said. I'm not surprised. But thank you for the opportunity to weigh in on the proposed flavor ban here in the city of Columbus. Many people will say that the people that represent public health organizations are only here because they are paid to be here. And while I'm a representative of the American Heart Association, and our mission at the AHA is to be a relentless force for a world of longer, healthier lives. And we are dedicated to ensuring equitable health in all communities and have been a leading source of public health information for nearly a century. We support this legislation, including the ban on flavored e-cigarettes and tobacco products, including menthol cigarettes. But I also wanted to discuss a personal matter with this situation. My family, my great-grandfather was the only smoker in the Durr family or the Holfinger side of the family forever until the year 2000. And that's when I started smoking. I grew up in a 3 traffic light town. I played baseball. I had the hole worn in the back of my jeans, my baseball uniform. I started dipping at the age of 14 or 15, cherry flavored Skoal. I can't even smell the stuff now, it's gross. When I got off to college, I didn't need to worry about smelling or not smelling like a cigarette or smelling like a cigarette, my parents catching me. I immediately took up smoking, and I was a smoker until the year 2017. That was 2 years before I joined the American Heart Association. And every day, my why is to stop people like me from ever picking up this habit. I have a 9-year-old daughter. I never want to see her addicted the way I was. Many of the people at the State House that I've known for many, many years knew that if you saw me walking from one building to another, I had a cigarette in my hand, constantly. I had toothpicks behind my ears at all times to chew on during committees just like this, because I wanted a cigarette that bad. Do I still want it? Yeah, sometimes. But I won't, because I know the dangers that this causes, and I know what it can do to you internally, from the research that we've done at the American Heart Association, to what I saw happen to my grandfather, to what I felt internally in myself, and the health issues that I had to overcome. And with that, I will say thank you for your time.
Thank you for your testimony this evening. I do have a question for you, though. It's actually a question that Councilmember Remy posed to the health experts, but for somebody who started their habit at age 9?
No, my daughter's 9.
I'm sorry.
I started dipping at the age of 14 or 15, and then started smoking at 18.
How did you stop?
We had a daughter, and that was really one of the major reasons. I tried Chantix. I tried the over-the-counter prescription cessation efforts. I thought about the vaping products because they were brand new. No way. No way. You saw what was in those things, and it's just as bad, if not worse, than what I was already doing. So over time, the toothpicks were a huge help for me. It was that constant interaction, that physical attachment to it. It was exercise. It was being willfully cognizant of that addiction and knowing when I can just say, no, you're not going to do this today. Chew a piece of gum. If kids wanted flavored products, fruit stripe gum may not last very long, but at least it's a flavor that is not going to kill you in a product like e-cigarettes. And that's how I quit eventually.
Thank you very much. Welcome, the Honorable Senator Charlita Tavares, back to council.
Thank you very much, Madam Chair, and to Councilmember Remy. I'm going to share my prepared remarks, and I also have copies to share with you. To our Health and Human Services Committee Chair, Councilwoman Faber, and members of Columbus City Council, I'm Charlita Tavares, Chief Executive Officer of Primary One Health. We are a comprehensive primary care community health center system serving over 44,000 patients in Columbus, Franklin, and Pickaway counties. Our patient populations are diverse, with over 34% African Black, 38% with English as a second language, 29% Hispanic Latino, 5% American Indian, Alaska Native, or more than one race, 4% Asian Pacific Islander, 3% homeless, and 3% LGBTQ+. We are the oldest and largest FQHC community health center in Central Ohio and the second largest in the state of Ohio. I shared our patient demographics to show that our patients are those who are being targeted, racial, ethnic, and cultural communities for deadly flavored nicotine products. Flavored, including menthol, candy, and fruit-flavored cigarettes, e-cigarettes, cigars, chewing tobacco, and other products. This is a deliberative and strategic decision by Big Tobacco, not unlike opioid and other drug dealers, to lure individuals, and especially children, to become long-term customers of a disease and premature death product. They do this by hiding the ugly taste and burning sensation of their products to facilitate addiction among their prey. These are deliberative and calculated actions discovered during litigation throughout the country to grow profits over people and disease over health. Members of council, I am here today to ask that you stand up for our children to prevent them from buying these deadly addictive drugs by banning the sale of flavored products. Stand up against the purveyors of disease, illnesses, and death by preventing the sale of these products to our individuals, mothers, fathers, relatives, and friends from spewing secondhand smoke. Stand up against the myths, lies, and distortions of Big Tobacco, who are crippling our residents with nicotine addiction, chronic diseases, and death. Take action to pass a flavored tobacco ban, a flavored tobacco sales ban to help my over 4,000 patients 10 years of age to 20 years of age from being able to buy flavored tobacco products in Columbus. Thank you.
Thank you. Next, we have Nizal Aburada. Nizal. And after that, Hassan Omar. Do we have a Nizal Aburada? Hassan Omar. Welcome back to council.
Hello, City Council members.
Sheila Favor and Ramney. I'm glad to be here today to speak on behalf of New American about the tobacco. I know there are experts, doctors who've been testifying, and leaders who are working with the community every day. But one area that I would like to talk about tonight is something called shisha, which is affected badly to the community. Shisha is the second global tobacco epidemic since the cigarette. Shisha has become a social activity that targets young teens and adults in the United States, especially Columbus, Ohio. Shisha flavored tobacco that is smoked with water pipe. The smoke exposes people addictive chemicals, nicotine, carbon monoxide, and contains the same toxic chemicals found in cigarettes. Shisha smokers' smoking sessions are generally longer, which result in considerably greater nicotine exposure. According to the American Lung Association, a typical 1-hour shisha session is equivalent to inhaling 100 to 200 times the volume of smoking from one single cigarette. Shisha smokers are more likely to be associated with lung cancer, respiratory disease, and low breath weight in babies. Research has found that cigarette smoking and the shisha smoking have a similar effect on the person's breathing. Additionally, sharing a mouthpiece during the smoking sessions can spread infectious disease such as herpes, influenza, hepatitis, and tuberculosis. The increase of availability of shisha and the use of flavored tobacco makes shisha attractive to teens and the young adults. It became a common the young establishment. Most of shisha is located near the colleges and the campuses. The increase of popularity is driven by effective, attractive, flavored in the tobacco mixture and the perceptions that people believe that shisha is safer than cigarette smoking. In conclusion, we are urging the city of Columbus to regulate the shisha and treat as they treat the other tobacco products. Many families are worried about their kids when they go to schools. They miss the classes. They waste a lot of time. And also we found that most of the people who are shisha owners live in a good neighborhood and they don't care the other kids who they are selling that tobacco product. So I'm encouraging the city of Columbus to regulate and look into it.
Thank you for your testimony. Next, we have John Dixon. After Mr. Dixon, the Honorable State Senator Ray Miller. John Dixon, welcome to council.
Thank you. I want to come and talk from a couple of different perspectives. One, I'm a 40-year law enforcement professional. Second, I'm a black male. Thirdly, I'm a father of black males. Start out with, being a 40-year law enforcement professional. Bans don't work. I mean, we got history and history over there. You'll hear people come and say, oh, they do, they this, but the history of it is prohibition didn't work. If you ban Gucci purses, guess what? They're going to come up with Gucci purses. It's going to be a follow through because it's a product. It's supply and demand. Very simple things. As long as you have that demand, somebody's going to figure out how to supply it. The difference is it's not going to be quality, it's not going to be regulated, and they're not going to care who they sell it to. At least now, and I heard the numbers saying 70%, but I guarantee you all the retailers that's here complying to everything that needs to be done because they want to continue to sell the product and they want to continue to adhere to the law. So they're going to do the right thing. Those who don't, nobody wants them. It's just like cops. You don't want bad cops. You want to get rid of them. You want to get rid of bad retailers. So, putting those things in place help. As a black father, I don't want any reason to police, health department, or anybody else that want to regulate a young person. And to me, it's a falsehood anyway, because, I did a survey with my own son. He's 25 years old. I said, how many of your friends smoke cigarettes? He said, none. I said, how many smoke marijuana? He didn't even want to raise his hand to me. Because that's what's happening now. It's no longer focused on menthol cigarettes. It's focused on marijuana. That's what the kids are doing now. You know, and if they were looking at those things, then that's a different story. You know, and as a black male, at some point in time, choice should be up to me. It's a legal product. Menthol is a legal product. They're not going to take menthol out of everything because it's going to be menthol cough drops, there's going to be menthol other things because there's other uses for it. As a, you know, when and what time is the government is going to say, okay, you have a choice. You know, this is a choice. I don't have a choice when the police come behind me and people say, oh, you know, Ferguson was set up to be a fine. Look what that ended up being. You know, there is no enforcement that can take place without somebody being able to enforce it. Because when I say I'm not going to do it, then what? And then the second thing is the whole illegal process, the underground, that's going to happen. It's already happened. I heard one of the council people say, well, I'll wait till that happens. That's the problem. Bad policy is bad policy. The war on drugs was the war on drugs. Look what happened with that. Now they're coming out with saying, oh, yeah, we intentionally focused the war on drugs in black and brown communities. All I'm saying is take a look at it, talk to your professionals, and you'll find out the truth.
Thank you for your testimony, sir. And I will continue to reiterate that this proposed regulation will not criminalize or penalize individual behavior. I think that has to be said over and over again, that this is not about criminalizing individual behavior. With that being said, welcome back to council.
Thank you much.
Honorable Ray Miller.
Madam Chair, members of the committee, I gave an interview earlier today with a very intelligent young man. I think I saw him out earlier when we came in the door. A reporter from Channel 4 Television. He had been told that I have a story to tell. He said, I heard that you have a story to tell. So he jumped right into his questions and asked me the following. So I understand you have this story to tell regarding tobacco targeting. Why, he asked, do you have an interest in this topic? Well, I had about 25 things I could have said at that time, but we went from there. So I calculated in my head that we would give about 15 minutes for the interview and be on with the rest of our day. The two of us were thinking alike, and he said to me during the setup for the interview that this should only take about 14 minutes. He was really right on target because I was thinking it wouldn't take any more than 15 minutes. And after at least a half an hour, we were still probing deeper and deeper into the causes of my interest in tobacco targeting. Had I been hurt, he said? Did I know someone personally who had been hurt in some way, negatively affected by big tobacco, or was I just searching for a horse to ride? Yes, yes, and absolutely not. Those would be the responses. Every substantive issue in which I have engaged myself over the years has been done in large part because of my face-to-face involvement, personal knowledge, and commitment to equality, justice, and the firm belief that we should all do our part to help our brothers and sisters who are in need. If you know that big tobacco is driven by profit, then find a way to redirect your time and your energy to obtaining greater outcomes for the strategy you have undertaken. If you know something, do something. When someone seeks you out and appeals to you for help and direction, find a way to give them the assistance they need. Do something. Come out of your comfortable cubbyhole and actually do something. Do you see what our colleagues did in California yesterday? They were committed to keeping their eyes on the prize and winning at all costs, and they did. Now it is our turn, and I know that we are charged and ready to go. Justice is on our side. Fairness is on our side. And when you look at the thousands of young lives that have been lost, we know that God is on our side. Ron McGuire, Keisha Hundley, Mayor Coleman, Congresswoman Beatty, former Councilperson and State Senator Charlita Tavares, and hundreds of our friends and supporters are ready to move forward in a well-coordinated manner. This is just one of the powerful initiatives you will be undertaking. Now is the time. Thank you very much for allowing me these brief comments, and I'd be happy to respond if you have any questions.
Thank you so much for your testimony this evening. Up next, we have Megan Kissel. Following Ms. Kissel, Pastor Victor Davis.
Chair Favor and members of the council, thank you very much for having me. My name is Megan Cassell. I'm an advocacy director with the Campaign for Tobacco-Free Kids. And I'm here to support your efforts to end the sales of flavored tobacco in Columbus. So e-cigarettes, a lot of people refer to them as vaping. It's a bit of a misnomer because it's not just water vapor. We're talking about aerosolized nicotine. This is an epidemic for young people. Recent studies just this past year, self-reported from high school students, 2.5 million high school students across the country are using e-cigarettes. So what's that look like in Ohio? 1 in 4 high school students. 13% of middle schoolers. I come back to Dr. S.B. Bell talking about the sixth grader. So why is this even a problem? Nicotine has an incredible impact on brain development of young people. So when young people are using these products, it's fundamentally having an impact on them for their entire life because of when they're starting. And once you get addicted to nicotine, you are far more likely to continue using nicotine, and as you've heard, move on to being a cigarette smoker. The Surgeon General has actually referred to this as a significant and avoidable health risk for young people. So what's driving this? Flavored tobacco. I have a niece who just turned 9, and I might have gotten her hooked on cotton candy during a baseball game one time. And I can guarantee she knows, like in her 9-year-old brain, she knows cigarettes are bad. But if somebody hands her, hey, do you want to inhale cotton candy? Her little eyes would absolutely light up. And that's what worries me. She's not going to know the difference. It doesn't smell like tobacco, doesn't taste like tobacco, but man, does it have the same kick. This past summer, there were high school students in Columbus who were doing a student survey, and they asked their peers, hey, would you use tobacco products if they didn't come in flavors? The answer was a resounding no. Absolutely not. So just being really clear about what this is and what we support is it's ending the sale of flavored tobacco. We're not talking about getting rid of all tobacco, and there's been a lot of discussion, good discussion about tobacco cessation, but this wouldn't eliminate all tobacco products, just the ones that are an on-ramp to addiction and the ones that are fueling some of the health disparities that you've heard so much about. And I do want to reiterate that this is not a cessation device, no matter how much people claim. It's not authorized as that. But thank you for your time and consideration.
Thank you for your testimony. Up next, we have Pastor Victor Davis, followed by Sudarshan Pairikul. I know I mispronounced that. Welcome back to council.
Good evening. I'm Victor Davis, the pastor of Trinity Baptist Church, and I stand tonight with the support of over 7,000 signatures that are to my right, to your left, and 80 pastors who support the ban of tobacco-flavored products. There's a little girl that I have the privilege of knowing by membership of my church. She's 7 years old. She's presently in cancer remission. It is assumed that she got cancer from secondhand smoke. And I'm sure at 7 years old, unless she got into it like some of us who tried smoking earlier than we needed to, that secondhand smoke was laced with flavors. It is my hope that she will remain in remission. It is my hope that she will live a long life and be healthy. But every time I see her mom and every time I see her with her hair gone and with her color darkened from chemotherapy. I think of how tobacco has affected her life uninvited. It is my hope that council will take the lives of citizens of this community, especially our children, into consideration and will ban flavored tobacco products. Thank you and have a good evening.
Thank you, Pastor Davis, for your testimony. Up next, Sudarshan Payakul. I apologize, I know I.
Thank you, Chair, Council Member Flavor, and Council Member Remy. Today I'm here to speak on behalf of banning the sale of flavored tobacco product. And it's my belief that this is impacting my community as well. And this is a testimony that it's a new community. We have been in the US for less than 10 years. And if you look at the map earlier, the researchers here, it's where my community live. Same zip code, same neighborhood, where you can see big dots. And we had seen in the last 5 years, there's increasing use of tobacco product and flavored tobacco product in my community. And earlier, I'm also a mental health researcher and a social worker. And I was having conversation with my colleague at Ohio State University with Dr. Mark Troyer and Dr. Other physicians, and they asked me why there is such an increase in diabetes in your community. And they were concerned because 10 years ago when this community came, and 10 years now, the diabetes has spiked in the Bhutanese Nepali community. And it's no coincidence that the incidence of increasing diabetes coincides with the increasing red dots in the neighborhood where my community lives. And so that's one concern. I know diabetes is not directly related to it, but I'm giving you a context to it. There's a worsening healthcare in my community than when they were coming from a refugee camp. This is an alarming issue for us. One of the issues that I really wanted to share is I'm a community person. I work at the community. I'm a social worker. A single mom comes to me and says that my 14-year-old child is addicted to smoking. And it's a long story short, but we wanted to investigate how he found that product. And it come to our attention as we were investigating. They were provided for free when they go to school. When they were walking towards the school, somebody would just hand them. And in the beginning, something would taste like chocolates or any other product. And then later on, they would hook to smoking or product that is very addictive. And then this is just one case I'm sharing. There are multiple cases. And why I'm bringing this is because it's a new community. They are just trying to establish themselves here in the United States. But this epidemic is taking life, young and old. And we really strongly advocate in favor of banning this product. Thank you.
Thank you for your testimony this evening. Asmat Kaheen. Asmat Kaheen. Luster Singleton. Luster Singleton. Asmat Kaheen. All right. Jasper Person. Jasper Person. Julia Applegate. Do I see someone moving? Julia Applegate? Welcome to council.
Thank you so much. My name is Julia Applegate, and I speak to you today from 3 perspectives. As an adult child of parents and grandparents who were killed by tobacco-related cancer, as a parent of school-aged kids at risk for tobacco targeting, and as an LGBTQ public health advocate. First, as a child, I lost 3 of my 4 grandparents as a result of tobacco-related illness. My paternal grandfather died before I was born. My maternal grandfather Died when I was 6, and my maternal grandmother died when I was 14. All of them were lifelong smokers, some using flavored products, and others using cigarettes without filters. The sound of my beloved Mima coughing repeatedly before, during, and after her daily pack of cigarettes is a sound that stays with me still 40 years after her death. She was 59 when she died. My mother outlived her by 3 years, continuing to smoke even while connected to oxygen. As a 52-year-old woman myself, I am only 10 years away from the life expectancy for women in my family. Fortunately, I have not used tobacco products because I saw my loved ones die at the hands of these addictive substances. As a parent of 2 Columbus City school children, aged 9 and 11, I am deeply troubled by the data on tobacco targeting of youth and from stories I hear of children just a few years older than mine. Sugar-sweetened tobacco products are intentionally designed to appeal to kids with flavors like bubblegum, cotton candy, and sour apple. Kids are lured into trying harsh and dangerous and addictive tobacco products masquerading as candy. The addition of sweet flavoring to these products hides the harsh flavor and burning sensation of straight tobacco. The availability of these products masks the dangers caused by addiction. Children should not be pawns of the tobacco industry, hooked as early as their preteen years and at high risk of lifelong addiction. As a public health advocate for the LGBTQ+ community, I see the disproportionately high use of tobacco products by my peers, whether as victims of 1990s targeting campaign Project Scum, or as young people newly drawn to flavored vapes and e-cigarettes. Too many of my LGBTQ+ community is trapped in a cycle of addiction to tobacco products. We have been targeted and hooked on free cigarettes passed out in bars and nightclubs, free vaping supplies handed out at pride festivals, free snuff and nicotine pellets distributed at music festivals. The tobacco companies know we are vulnerable to their marketing, often turning to their products to cope with the damaging impact of homophobia and transphobia. Lesbian and bisexual women and trans youth of color are at particularly high risk. All of that said, I'm pleading with the members of City Council to protect the most vulnerable members of our community from the availability of these products. Addiction is not liberation. Thank you.
Thank you for your testimony this evening. I'm sorry, who?
You called my name and then she got up.
Well, what's your name, sir?
Jasper Percy.
You just can't roll up to the podium like that.
Yeah, I was just coming up because my name was mentioned and she came up.
All right.
First. Yes.
Welcome to council, sir.
Thank you so much.
Floor is yours.
Actually, I'm introducing 2 young men, Carter Robinson and Marquise Scales.
Welcome.
Good afternoon, Columbus City Council members and residents. I'm Carter Robinson, a proud member of Ubuntu Leadership Institute. I'm here to talk to you about the fangs that nicotine and flavored tobacco has bitten our youth with. Tobacco use remains the leading cause of preventable death in the United States, killing nearly 500,000 people each year. It causes or contributes to many forms of cancer, as well as heart disease and respiratory diseases, among health disorders.
Sorry. All right, good evening. My name is Marquise Scales, and I'm also a proud member of the Ubuntu Leadership Institute. Tobacco in Columbus, Ohio has been a big problem for not just older people, but for young men and women as well that go to school. We have a huge problem with more than 2 million U.S. middle and high school students reported currently using e-cigarettes in 2021, with more than 8 out of 10 in those using flavored e-cigarettes. I have seen in person a whole bunch of teenagers smoke, vape, do edibles, and drink alcohol in school bathrooms and other places. This is a big problem, as some of these habits can turn into health-related problems like cancer, unhealthy lungs, and getting into problems like driving under the influence of drugs and alcohol.
And then while we still have time, I'd like to talk about with 80% of my young peers who have ever used a tobacco product reporting that the first tobacco product that they used was flavored simply creates a targeted area of focus. Instead of addiction, I would use the word obsession. I'm hopeful that we are here working together to come up with resources and solutions to counter this epidemic. I believe we can do more to bring these solutions to our schools and community as a whole. Bad lungs slow you down. Thank you.
Thank you. Don't leave. How old are you?
18.
17, 18 and 17. And what do you all think we could do to reach young folks your age?
I believe I believe doing more in the educational space as far as better staff members equipped to handle things of this nature, community centers with the funding that we're receiving, also Big Brother mentorship programs as well. And we believe in the ban of flavor sales. No disrespect to the vendors, but this is very harmful and it's not the audience that you're trying to reach.
Did you have, sure.
I would also like to add that, this stuff can hurt and harm people our age, and people are, ruining their lives from the moment that they use these products. And, cancer does not care how old you are or how healthy you are. So I just want to say that I also support, this ban because, people are just ruining their lives by just using this product. And I feel like banning this can help, have a bigger step in, this solution of, ending this completely. So that's my opinion on it.
Thank you. And I just want to say, for the record, I am extremely proud of the two of you making the decision, whether you were voluntold or not, to be here this evening. You could be anywhere else, but you're engaging in the civic process, and I'm incredibly grateful for that. So I hope this is not the last time I see you two down here providing testimony.
Thank you very much. We're happy to be here at Ubuntu Leadership Institute.
Thank you. You real comfortable with the mic, sir. Real comfortable. I like it. Catherine Allender. Jamie Hall. Catherine Allender, Jamie Hall. Jamie, is that you? Welcome.
I want to thank City Council for the opportunity to speak today. I'm here as a former smoker and small business owner. Both of my parents are battling cancer right now, directly related to smoking. My mom has hospice coming to her house, and my dad had his first IV chemotherapy treatment just last week. Pardon me. Smoking is generational. Everyone in my family has smoked since I've been a small kid. My brother and I used to steal our cigarettes from our parents and grandparents. I smoked for nearly 25 years. I literally tried everything to quit. Nothing worked until I found flavored vapor products. I do not want to go down the same path as my parents and grandparents. In 2014, my wife and I opened Top Notch Vapor in Columbus. We currently employ 9 people. We pay them a living wage, and we pay them during the entire COVID shutdown. We use third-party age verification for every customer. As parents, we take that very seriously. If a flavor ban was to pass in Columbus, it wouldn't just affect the bottom line. It would be that business would be forced to close. That's mainly because 99% of what we sell is flavored products. My employees would be out of work, some of whom worked for us for over 5 years. We're a legal, regulated business, and we play a vital role in ensuring that customers have access to well-made products and keeping adult products out of the hands of young people. If these products are pushed into an underground market, there would be no oversight and no motivation to comply with regulations. My wife and I broke this cycle by switching to vaping. Neither of our adult sons use tobacco products. Currently, let's not forget, it is illegal to sell tobacco products to anyone under 21 years of age. T21 is working. Below 5% is what the current smoking rates are at, which is historically pretty low. At the last town hall, council members were asking what other measures could we take. I heard some earlier, they sound great. I think that you should require third-party age verification for every single person that sells tobacco products, not just who feels like doing it. Everybody should do it. You mentioned earlier that you were going to propose meaningful fines and penalties, possibly impose 3 strikes and you're out rule. I think all those are great, and we should definitely talk about that. I sincerely hope that these meetings aren't just for prohibition, and we can put our collective heads together. We all have the same goal, to keep kids away from tobacco products.
Thank you.
Thank you.
And Mr. Hall, I just want to say, you and your wife have been very pleasant to work with and offering tangible feedback that we can work with, which is definitely has been demonstrated in the 3 strikes rule, if you will, that that Columbus Public Health has proposed this evening. So I hope to continue in conversation.
Definitely, and thank you for that.
Absolutely.
All right.
Thank you for your testimony this evening. Up next, we have Dr. Ashley Abasal. Following the doctor, we have Shayna Wilson. Welcome to council.
Thank you, members of City Council, so much for having me tonight and providing testimony on the proposal to regulate flavored tobacco in the city of Columbus. You've heard from a lot of physicians tonight, and I'm here to represent the pediatricians. Nationwide Children's Hospital supports this measure as it will curtail the use of e-cigarettes in children, which can lead to addiction and negative health outcomes for children, adolescents, adults, their families, and our community. My name is Dr. Ashley Ebersol. I'm a board-certified pediatrician at Nationwide Children's, where I have worked for 7 years. I am also a board-certified adolescent medicine physician who practices substance use treatment and works in our program there. We treat patients who are addicted to nicotine and other drugs. Tobacco use begins almost exclusively during adolescence. According to the CDC, nearly 90% out of adults who smoke daily report that they started before the age of 18. Each day in America, 1,600 youth smoke their first cigarette. In 2021, nearly 80% of high school students and 75% of middle school students said that they used tobacco products in the past 30 days and that they were using flavored tobacco products. Adolescents and young adults are developmentally vulnerable to addiction, as we've heard already tonight. That addiction happens quickly, sometimes while adolescents are still experimenting, even before they're using daily or regularly. The availability of flavors is among the most prominently cited reasons for youth to use e-cigarettes. Studies show that candy and fruit-flavored e-cigarettes are more appealing than tobacco flavors to adolescents. They perceive that their e-cigarettes with flavors are less harmful than those with tobacco flavors, creating a potential misconception that e-cigarettes with flavors do not contain nicotine. I have had many patients tell me that their vapes do not contain tobacco, therefore do not contain nicotine, and that they are safer. They don't understand that they are harming themselves. Flavorings other than menthol have been banned in conventional cigarettes since the Family Smoking Prevention and Tobacco Control Act of 2009, as we heard about earlier, because we know that flavoring encourages youth experimentation and regular use results in addiction. The American Academy of Pediatrics recommends the ban of all flavors, including menthol and e-cigarettes. By banning fruit and candy-flavored e-cigarettes, children and adolescents will have less access to these addictive and detrimental nicotine products. With COVID-19, we've seen an increase in depression in adolescents. Many adolescents use substances to self-medicate, and we've seen that medical visits for adolescents for evaluation of substance use have increased with COVID. Vaping is detrimental to the health of children. In addition to the long-term consequences of tobacco, they're at risk for EVALI. There's also other consequences like hospitalization and death from that. Nationwide Children's Hospital is committed to policies that champion children's health and support the outcomes for best kids, and we support this ban on flavored e-cigarettes.
Thank you for your testimony this evening.
Thank you.
Shayna Wilson. Leo Almeida. Welcome back to council.
Thank you, Chair Favors, for allowing me to testify on this issue. I'm Leo Almeida, the Ohio Government Relations Director for the American Cancer Society Cancer Action Network. We are the advocacy arm of the American Cancer Society. I'm also a resident of Columbus. Try not to be too repetitive since a lot has been covered already, but tobacco use remains the leading preventable cause of death nationwide. In Ohio, it is estimated that 20,200 adults die from smoking every year. There are 259,000 Ohio children who are alive now that will die prematurely due to smoking-related illness. Flavors are a marketing weapon used by tobacco manufacturers to target youth and young people to a lifetime of addiction. That's very concerning to us at ACS CAN, especially when we think about the 73,300 Ohioans who will likely be diagnosed with cancer this year. In 2021, 80.2% of high school students and 74.6% of middle school students who used tobacco products in the past 30 days reported using a flavored tobacco product during that time. In 2021, 85.8% of high school students and 79.2% of middle school students who used e-cigarettes in the past 30 days reported using a flavored e-cigarette at that time. Adding insult to injury, tobacco manufacturers have aggressively targeted certain communities with their menthol products, leading to an unequal burden of death and disease. The overwhelming majority of all African Americans who smoke, 83.1%, report smoking menthol cigarettes. Internal tobacco industry documents show that the tobacco companies were intentionally targeting specific neighborhoods with higher Hispanic and African American populations with more advertising and promotions. The aggressive use of flavors and marketing tactics by the tobacco industry, rapid increased use of flavored products by youth and young adults, and under-regulation of these products requires Columbus City Council to take action to protect youth and young adults and the overall public health at large. As of today, 2 states and at least 170 localities have enacted laws restricting the sale of flavored tobacco products, including menthol cigarettes. It's time for Columbus to join them, and we strongly urge you to pass this ordinance.
Thank you for your testimony this evening. Zach Boyer. Following Zach, Chris Hudgens. Welcome to council.
Thank you, appreciate it. My name is Zach, my pronouns are they, them, and I serve as the Director of Programs and Marketing at Stonewall Columbus, Central Ohio's LGBT Community Center. I think there's been a lot that has been shared, and I won't go into too much depth, but to reiterate what my colleague and friend Julia Applegate stated earlier is that along with there being targeted advertisements and marketing campaigns toward Black and brown communities, there's also been a specific target toward the LGBTQ+ community. That meaning the lesbian, gay, bisexual, trans, queer, and questioning community. We know that that disproportionately affects folks who are living with intersectional identities of being both a BIPOC person as well as an LGBTQ person. We can look back to the mid-90s, such as Project Scum, which Julia talked about earlier. If you're unfamiliar, in 1995, the tobacco company R.J. Reynolds created a marketing strategy, Project Scum, which stands for Subculture Urban Marketing, to boost cigarette sales and targeting gay men and homeless individuals specifically with advertisements and displays in their communities and stores. Here is an excerpt from an email from 1997 talking about a situation analysis. A large percentage of gay and lesbians are smokers. In order to increase brand share and brand awareness for the Benson & Hedges brand, it is imperative to identify new markets with growth potential. Many gay and lesbian adult smokers also have a preference for menthol brands. So understanding that there is an overall commitment with Stonewall Columbus to increase the visibility and the betterment of LGBTQ+ people. We also have a commitment to health equity as well as racial equity. We see this all as imperative within a ban of the sale of flavored tobacco products, and I appreciate your time.
Thank you for your testimony this evening.
Thank you.
Chris Hudgens? Chris Hudgens?
Yes, I'm here virtually.
Oh,
Can you hear me?
my virtual person, yes. Welcome
Yes,
to council.
thank you very much. Thank you very much, Madam Chair and members of the council. I appreciate you allowing me to testify virtually. My name is Chris Hudgens. I'm with a company called Al Fakr. We're a producer of hookah tobacco, and I also serve on the board of the National Hookah Community Association. We're an association that represents really the entire community of hookah. We have producers like myself, as well as retailers, distributors, hookah lounge owners, as well as users. And I believe somebody mentioned this before, but last night, California took an important step, and voters there approved a ban on flavored tobacco. And that ban actually exempts hookah. And in fact, when Governor Newsom signed the legislation, he explicitly said that hookah is not the problem. Now, why did he say that? Because hookah is not a youth usage issue. CDC and FDA have put out data each year that shows youth use of flavored tobacco products. In the most recent survey covering 2021, hookah use was only 0.8% of youth reported using it, and that was actually down from 2%, over 2% a year before, and that's actually about 10 times less than that of vape. So why aren't children, adolescents using hookah? Hookah is very difficult to set up and smoke. You use a 2 to 3 foot water pipe to smoke it. It's not something a teen could hide from their parents very well, or is putting in their backpack and taking to school. It's also sold in specialty markets, ethnic markets, or specialty tobacco stores. You're not going to find it, and hookah lounges, you're not going to find it in a convenience store. So it's in locations where it's tough for a teen to access it, and we want that. We want to make sure that they cannot access it. But I also want to talk about the cultural significance of hookah. And when I talk about that, I'm talking about the practice that goes back almost 1,000 years of folks from the Middle East and India and that region have used hookah as a cultural and heritage practice for hundreds of years. And that's not the same as menthol. I should add, we don't produce anything but hookah. This is true throughout the hookah industry. We don't make menthol cigarettes. We don't make vapes. But we believe that the cultural significance and importance of hookah it should be recognized, and that's what's been done in California. And there are at least 10 hookah lounges in Columbus. I hope you hear from some of them today. These are minority-owned businesses, and a flavor ban would be a total ban on all hookah, because hookah has been flavored for hundreds of years. So we ask that you please exempt hookah from this ordinance. Thank you.
Thank you for your testimony this evening. Next, we have John Scott, following John Carter Robinson. Welcome to council.
Looks like we lost some council members. Guess they heard enough.
50 speakers will do that to folks.
My name is John. I'm co-owner of Vaporfy. Thanks for the opportunity to talk. I had the chance to attend the last 2 meetings. From these, I've gathered the concerns of the Department of Health are mainly focused around 2 issues: the use of menthol cigarettes in the minority community, and the use of tobacco products by those under the age of 21. Poor marketing tactics have been banned for decades. I know we keep talking about those. People who want to quit smoking are smokers of menthol cigarettes, right? There's two things there. Either A, how do we get them to quit if they want to quit, or B, they don't want to quit. Well, if they don't want to quit, that's their American right, just as it is to eat 4,000-calorie meal, or have a six-pack of Budweiser, or drink a 300-milligram cup of caffeinated energy drink. Caffeine, beer, all addictive substances as well. Around 10% of Americans are alcoholics. For those that do want to quit, a flavored tobacco ban will not help this issue. I think we can all agree that if we were to ban menthol cigarettes, that those that can't quit will just switch to regular tobacco. There have been many articles and studies done that show vaping and electronic cigarettes are less harmful than traditional cigarettes, including a statement by the FDA in October of 2021. Flavors in e-cigarettes and vaping devices have helped many people quit smoking traditional cigarettes. Even though these products are not classified as smoking cessation, they do work. We hear stories from our customers every single day. It should be a concern that banning flavored e-cigarettes and vape will cause people to switch back to these harmful cigarettes, traditional cigarettes, which would be detrimental and against what we're trying to solve here. As far as youth vaping goes, 29% of high school students drink alcoholic beverages per the CDC. This is a much higher percentage than those who use tobacco products under the age of 21. Underage drinking in Ohio is classified as a first-degree misdemeanor. Vaping underage has no consequence. Banning flavored vapes is not the answer. Taking these products away that have helped many adults quit smoking traditional cigarettes, deal with anxiety, or just use them for their personal pleasure, we should increase the penalties associated with distribution and the use of tobacco products by underage. Why do we punish those that drink underage but not vape underage if we're trying to get them to not use the products? Do not punish the mass majority of those that follow the law to solve an issue that deals with a small percentage of those that do not. If this were to pass, we only have 30 days once it goes into effect. That is not enough time. We have $20,000 a month in leases, long-term leases we have to get out of. Maybe our landlords will help them, more than likely not. Perhaps they can find tenants to replace us. It's going to take months for that to happen. We would need more than 30 days. I hope this doesn't pass. We urge you not to pass it, but if it does, we need more time.
Thank you, sir, for your testimony. Carter Robinson. Following Carter, Marquise Scales. Carter? Marquise? Thank you. Frankie Madosky. Following Frankie, Dorothy Flanagan.
Thank you, Council, for allowing me the time to advocate for my age group. My name is Frankie Wadowski. I'm a 17-year-old high school senior. I'm surrounded by minors who abuse flavored nicotine products. Actually, did you know many of the disposable vapes sold actually start at 5% nicotine? So you can't get anything less than that. You start at a very high percentage, equal to 1 pack of cigarettes. This includes top-selling brands like Views, Elf Bars, Hides, and others. According to the health website SingleCare, 63.5% of vapers are under the age of 18. The customers purchasing these flavored nicotine products are people from my age range, 14 to 18 years old. The high percentage of nicotine leads to higher addiction levels. For example, at these critical developing ages, the brain is still highly impressionable. Nicotine also changes the way synapses are formed, which harms the parts of the brain that control attention and learning. With a staggering 63.5% of vapers under the age of 18, we must all do better in prevention. While the remaining age range for people vaping is 18 and over, leaving only 36.5 at the legal age to consume flavored nicotine products. Even though the law states you must be 21 to purchase flavored tobacco products, it is still easily accessible for minors. Many of the stores selling these products do not even require proper identification from minors purchasing the flavored nicotine. In addition to improving prevention, we should also enforce stricter penalties for businesses selling flavored nicotine to minors.
Thank you for your testimony. Hold on, don't leave. Don't leave, don't leave, don't leave. Come back. I'm going to ask you the same question that I asked the other two young gentlemen. Outside of a flavor ban, how do you think that we can best help to educate and reach young folks around this issue?
I think it should be advertised more on social media, actually. everybody has truth that's all over people's social medias and their Instagrams and their Facebook, but people are tired of truth. We need younger people our age to reach out and to be able to come forth and agree that nicotine is not the right answer.
Thank you for that. Appreciate your testimony this evening. Flanagan. And then we have Elliot Boyce. Thank you and welcome to council.
Good evening, Chairperson Favor. My name is Dottie Flanagan, and I am here in my capacity as a middle school principal in Columbus City Schools. And I respectfully ask you to end the sale of flavored tobacco in the city of Columbus due to its increasing and dangerous use among our children. The new look of nicotine addiction in our schools is vape. It's sweet, it's cheap, it's easy to get, and it's also something kids want. And now it's a daily reality in our schools. In the past several years, educators around the nation have reported significant increases in number of students who use nicotine at school. Students have become masterful at hiding brightly colored vape pens in pockets and undergarments, and we've observed students at the middle school level who, at the ages of 11 to 14 years old, are sadly already addicted to nicotine. Nicotine addiction in our schools creates just one more barrier for our children to hurdle. And the educational barriers to good health, both physical and mental health, and educational impacts are even greater. In my school, we observe that children who vape are much more likely to experience reduced instructional time due to class and school absenteeism and truancy, and then consequently lower grades, situations that our students simply can't afford. Most students who we've recently caught vaping at school, who we've experienced, have been victims of trauma. Sometimes they're already struggling academically, and so the nicotine helps with anxiety and some of the negative feelings as a result of their lived experiences. They feel like what they get from nicotine helps them cope with those stressors. And when this coping mechanism becomes the norm for those most fragile learners, it spreads to everyone else. Many students who regularly vape have shared with me that they know vaping is addictive and bad for their health, but they minimize the health dangers associated with vaping, saying they simply don't care. They feel that it's the new smoking. And sadly, in conferences with parents, many have shared similar sentiments, believing that vaping is a healthier option to smoking. And sadly, some parents have even admitted to me that they have purchased vape for their middle school students. The vape pens we've collected at my school are clearly marketed to children. They have catchy names like Rainbow Sugar and Skittle. They're colorful and they're affordable. They come in flavors like Blueberry Energize and Cotton Candy and Watermelon. The vape pens are easily accessible to students at corner stores and in their homes. And because it's odorless, vaping is efficient and oftentimes unnoticeable by others. Students vape at recess, in the hallways, in the restrooms, and believe it or not, sometimes in classrooms. And it's very difficult to manage from our end. So we need your help. Our children need your help. We know the negative health impacts. We have the data. So please, I implore you to help us protect our children in Columbus from being prey to the big tobacco companies. Let's break those systemic racist practices and give our students some hope here in Columbus and around Columbus City Schools. They deserve our protection.
Thank you. A question for you.
Yes, ma'am.
How often are you seeing repeat offenders?
All the time. Our students who we catch vaping, and again, in the last few years, it used to be you never heard of kids vaping in school, but it's often now, and they always repeat because they can't stop.
And you have had students admit to you that some have got the vapes from their parents. Where else have you heard they've gotten the vapes?
From parents, friends will bring them. I think we heard a speaker earlier say that they'll find homeless people, pay them a couple dollars, and they'll go purchase the vapes for them. My school sits in South Clintonville, just north of campus, and some of our feeder elementaries, the Wyland Park feeder in particular, I think there were 19 shops within a short distance of that school. And, and so they're just close to our students, to our schools, our elementary schools and homes.
Thank you for
You're
your
welcome.
testimony this evening. Elliot Boyce. Following Mr. Boyce, Todd Hicks. Welcome to council.
Thank you. Thank you for having me. My name is Elliot Boyce. I've been a trooper for 36 years. Most of my career I spent working undercover, dealing with drugs and drug trafficking. I will tell you, the minute that you make this ban or this ban goes through, it becomes prohibition, and the word that everyone needs to remember is called contraband. And the second that you make a ban on any cigarette, it's contraband. And the people that you put in danger are not only the kids in your community, but that police officer, because he's going to have to deal with that. And I know you keep saying it's not going to be a thing where it's going to be impacted by possession of it, but the trafficking of illegal cigarettes in your community is going to increase. I know you just had a press conference today talking about gun violence. Good people don't kill people. Drug dealers and smugglers do. And because of that, that's how your gun violence increases. I keep hearing people talk about the statistics of the number one cause of death for African Americans are cancer-related illnesses. Well, you got to finish that sentence. The number one cause of death of African Americans as it pertains to cancer is over the age of 64, right, by the CDC. But the number one cause of African American males that are dying are due to homicide, and that's between the age of 12 and 18. So you can't get to 64 if you're dying on the streets due to gun violence. The other thing I keep hearing or heard since I've been here was the red dot. We reduced some of your mom and pop stores are nothing more than tobacco licenses. But the truth is they are substituting for a quality of life issue, which is your food deserts in these areas. So I watched the shows the slides up top, and every time I saw a circle with 19 different tobacco licenses in there, I didn't see any grocery store that would supplement for those areas. We talked about that the income in these areas are low income. Well, we happen to know for a fact for years we've been battling for quality of health care in areas of low income also. So how do we get education, treatment, and counseling of the services that will help individuals in these communities are not being provided? All right, so that's historically. We talked about, the gentleman here said that, in order to combat this with Tobacco 21, they take kids or they need more resources and they take them in under the age of 21 and they send them into the stores to buy. That's called undercover. When I did undercover, I had 5 cops behind me. Soon as you ban it, the individuals that work in his office that you could be sending in to buy these cigarettes, you put them in harm's way. The doctor who runs the health department said that the retail owners are not complying. Well, that's her job to make them comply. There's 820 licenses, they said, in the city, and they only did 1,200 checks last year. So if you do better compliance, better enforcement, you have a better outcome. Unfortunately, without that, what happens is you're going to ban this. The word you got to remember is contraband. And health department doesn't deal with contraband. That police officer does. And you put him in harm's way along with the community. Thank you.
Thank you. Thank you for your testimony, sir. Todd Hicks, William Carter. Mr. Carter, welcome to council. Following Mr. Carter will be Pastor Howard Washington.
Good evening. I've been here for quite a while. I'm just trying to, first of all, I'm hearing a lot about nicotine versus candy, and I'm just thinking in my head, how do we, there's a bigger issue here of what's in the vapes, what's in cigarettes that this maybe is not going to address. But I'm going to come more from the perspective of what I'm dealing with as a middle school counselor in Columbus City Schools. Also as a parent of a 5th and an 8th grader. Obviously, a lot of the data presented speaks for itself. There's a lot of things as a counselor we're going to circle up. We're going to have discussions. We're going to try to take in all accounts of the things that's all involved. But it's the reality is it's not necessarily in the flavor. It's in the things that hide below. the things that cause the addiction. And, you know, asking the why and how is, are these things getting into the hands of our young people? So just kind of from my personal insight, experience, and observations with our youth behaviors, you know, obviously we all know that there's considerable health concerns to consider to consumers, but also with young people, as someone stated, because they're still in their developmental years. You know, I know that it's accessible to underage children because we see it, because middle and high school students are using them and bringing them to school. You know, I can assume that the flavor is much more appealing than a normal tobacco product, not being a consumer myself. But one thing that I want to discuss is, like, I brought this Sharpie. A student can have a Sharpie in their materials, and inside of it is a vape pen. This is not one. So it's easy to hide. It's easy to give to somebody else. It's easy to just enclose. So no, it's not. It can be in plain sight. There's an article I read before I came today about hiding vaping in plain sight. Also, I brought a USB drive. You know, something, and students can make it look similar to that. So a teacher, you know, a principal, a counselor, an adult's not going to necessarily be able to catch that. So, you know, a lot of times we're asking schools to get involved with a lot of different resources that we can offer to students and families. Well, if we're not catching them and we're not able to catch them, we're not able to curb the behavior, I guess, is kind of what I'm trying to say. But how do we as a community continue to allow these to get into the hands of our young people? That's the bigger issue. Is it going to, you know, there's lots of things that students get involved with that they shouldn't. But that's just kind of what the question that I had in mind. And then also, if you have to be 21 to get one, either people under 21 are going in and getting them, or, oh, wow, geez, that was fast, or somebody's giving it to them. And so just kind of as a parent, as a teacher, you know, students were actually using social media to exchange vapes in our school to hide them. So didn't get through everything I wanted to say, but those are some of the issues that we're seeing within the school.
Thank you for your testimony this evening. Pastor Washington, and following Pastor Washington, Mary Spies. Welcome back to council.
Good evening to Chair Favor and to City Council, to all you who are present tonight. I am Pastor Washington. I serve as pastor of the Second Baptist Church. I also serve as president of the Baptist Pastors Conference in Columbus and vicinity, and also moderator of the Eastern Union Missionary Baptist Association that serves over 34 churches here in the city. I'm here to support the legislation that has been discussed. We are concerned about protecting the health of our youth, protecting the health of our communities. I serve in the Near East Side, and we've been in this area for more than 16 years as pastor. Our church has been in the city for over 185 years, so we're very familiar with the growth, with the champion schools, with Trevitt, those in our area. And so we're concerned about what's happening to our youth, and allowing the sale of highly addictive flavored tobacco products is a problem for us. And so we want to work with you. We want to support what you're doing. So I say that to say that whatever you can do to listen, to learn, but to limit the access of these very detrimental products, we'd appreciate it. This issue is not just a concern for our community, but it also is close to home for me. My mother was a person who loved dearly, but she was addicted to nicotine, and she died a premature death, suffering from ARDS in the hospital for 20 days, partly because of being in a windstorm, catching pneumonia. and having smoked tobacco for a majority of her life ended early. She missed my ordination. She missed my first installation in my church. She missed seeing her grandchildren. And so as I close in my last 40 minutes, I think about children who are being raised now and this tobacco addiction to nicotine and what it can do to our lungs, what it can do to our health, and the adverse conditions that it causes for our community. So I ask that you act swiftly. I know that you're doing everything that you can to hear all sides, but at the end of the day, let public health and our quality of life be a guiding force. The words of scripture from Micah says, do justice, love mercy, and walk humbly with your God. So thank you for this time.
Thank you for your testimony this evening. Mary Spies, following Ms. Spies, Scott Ely. Welcome to council.
Thank you for allowing me to speak today. My name is Mary Spires. I am a resident of Columbus and the store manager at South High Carryout for the past 25 plus years. We have approximately 15 employees and most have been with our company for 10 to 15 years. We are family. We have watched each other's kids grow up and depend on each other. I am here to request that you do not move forward with this ban. We are not in the business to encourage our youth to pick up this habit. We are 8 minutes from Obetz and 10 minutes from Grove City. We will lose our customers. We will have to let go of employees. Customers will make that drive for the products that they would be unable to offer them. That means losing sale on all of our products our customers buy when they come into the store. This proposal is not the solution. Banning menthol cigarettes and flavored dip and cigars puts us at a huge disadvantage and will benefit the businesses around us. Headline news this morning, studies showed 1 in 5 deaths are alcohol related. I was also hit by a drunk driver in 2000 and unable to walk for 6 months due to an accident where the driver instantly lost his life. The bottom line is there is so many things out here that are hazardous to our lives, and no one wants to be told that they can't do something when they are of legal age. A better solution is to focus on educating our community on the harm of these products can cause and ensure retailers are licensed and responsibly selling the products, and let the state make the decision so we will remain equal to all of the businesses around us. Thank you.
Thank you, and I appreciate your engagement throughout this process. As I stated earlier to one of the other retailers, we are listening, and we're moving in real time. So thank you for your continued advocacy.
Thank you.
Scott Ely? Am I pronouncing that? And then following Scott, Bruce Barcelo.
Thank you, Council Member, for this opportunity to speak in opposition of the proposed ban on flavored vaping products and tobacco products. My name is Scott Ely. I'm the president of the Ohio Vapor Trade Association. Our organization consists of a membership made up of small specialty vape stores throughout Ohio. I serve as the president on an elected, non-compensated voluntary basis. I previously provided these numbers I'm about to share, and I will also provide the citations in my written testimony, which I have previously submitted. Nationally, as of 2022, 14.1% of those under 21 vape. This is a 53% reduction since 2019 and lower than in 2015, 2 years before the FDA declared a youth epidemic and before Juul was even launched. Focusing locally, according to the latest data for Franklin County from the OYES survey, the Ohio Healthy Youth Environment Survey, conducted by the Ohio Department of Health, 7.7% of youth vape 1 puff or more in a 30-day cycle, nearly half the national average. Of that 7.7%, only 30.3% have 1 puff or more on 3 days or more out of the month. 30.3% of 7.7% is 2.3%. 2.3% puff 1 vape or more 3 or more days out of the month. Only 2.2% of youth smoke cigarettes. This is hardly an epidemic. Again, these are not made up numbers. This is from the Ohio Department of Health. This means that there is no gateway from vaping to smoking. We have nearly eliminated youth smoking, and we've nearly eliminated youth vaping. Why is City Council, the mayor, and Columbus Public Health not celebrating? This is a historic win for public health. Understanding that zero youth use is unrealistic, what do these numbers have to be in order for us to say that we have eliminated this threat? Meanwhile, 10.6% of Columbus youth have smoked marijuana in the past 30 days. City Council should focus on Tobacco 21, the new approach that was just presented here today. I'd like to take a look at it more, but it's a much more pragmatic approach to limiting youth access to these products. But I would say that City Council should take that approach first, or approach similar to that, not prohibition. Prohibition has never worked, and it will never work, even if it's funded by billionaire Michael Bloomberg. And I'll just end here by saying, again, I want to highlight a recent NIH National Library of Medicine study that showed, quote, conclusions, quote, e-cigarette use is positively associated with both making a smoking quit attempt and a quit success. Those using flavored e-cigarettes, particularly menthol and mint, are more likely to quit successfully. This is NIH's conclusion, the National Institute of Health, not industry's conclusion. Thank you.
Thank you for your testimony this evening. And if you can, I'll restate, everyone, please feel free to send your testimony to Flavor Tobacco. If you could send your testimony, you had a lot of data points. I'd like to get into those as well. Welcome to council, sir.
Thank you, Madam Chair.
Bruce, correct?
Yes, Bruce
Thank you.
Barcelo. Yeah, my name is Bruce Barcelo. I'm faculty member of the Breathing Association here in Columbus and just started my third term as the chair of the Tobacco Free Ohio Alliance. But tonight, I am here representing Parents Against Vaping E-Cigarettes, or PAVE, a national organization that represents the parent voice to fight and protect our youth from the struggles of nicotine addiction around the country and here in Columbus. Parents write us every day to describe the once promising futures that their children now are derailed by nicotine. Their debilitating behavioral changes and devastating physical problems. I myself, as a parent, went through this with our daughter. The worry and helplessness that you feel as a parent is often unbearable. As a grandparent, I want this scourge on our kids eliminated before my grandchildren become susceptible to the tobacco industry's reach. I hope you take time to talk to school administrators, teachers, and school resource officers, as I have the opportunity to do. They are dealing with kids that are getting nic sick because of the new nicotine content in the constantly released new products. Students who can't sit still in class because they need to vape and may be suspended. Youth that use these products have a major impact on academics and dropout rates. Because there's freedom to make false claims, many youth believe that these products are harmless as a cup of coffee. Yet we know that these products are not approved by the FDA for cessation, and claims of supposedly healthy vapes are fraudulent. Parents Against Vaping E-Cigarettes recognize that all flavored tobacco is being targeted to youth to hook them on a lifetime of nicotine addiction and the associated physical and mental health struggles. We support an ordinance that reflects the elimination of flavored e-cigarettes, menthol cigarettes, and all flavored commercial products. Thank you, Columbus Public Health, for your tremendous work on this policy. Thank you, Columbus Commissioners, for what Parents Against Vaping E-Cigarettes knows is a challenging but obvious decision that will impact health of generations to come. This is a legacy policy that all Ohio will follow. Now is the time. Thank you.
Thank you for your testimony this evening. We made it, guys. We got two more. Carol McGrawder. Following Carol, Alicia Hopkins. Welcome to council.
Good evening, Chair Favor. My name is Carol Magruder, and I am one of the very proud co-chairs of the African American Tobacco Control Leadership Council. We are based in California, and we have been working nationally. We've been at the forefront of the national movement to remove mentholated tobacco products from the U.S. market. And so we are very encouraged to be here with you. I flew in from California. I missed my Proposition 31 celebration party last night because we passed it statewide in California after a big pushback from the industry. So we work at the intersection of public health and social injustice, and we work to save the 45,000 African Americans who die every year directly from tobacco-induced diseases. And so there's been a lot of talk tonight about targeting and about the problems of our children. So I want to say the biggest targeter, the biggest profiler, the biggest killer of black boys like the ones who came and spoke are the tobacco industry, who are in fact federally adjudicated racketeers under the Racketeer Influence Corrupt Organization statutes. And so a lot of the rhetoric that the tobacco industry uses, it's really about a turf war because they have their clutches in our community, seeding death, addiction, and disease, and they do not want to let go of their customers. And the only way that they can survive is to recruit new people, and those are our children. And so we want to say that we are supporting you. We have been here with the doctor who started, Dr. Roberts, talked about the measles. And so when we look at addiction, addiction is really a communicable disease. You catch addiction. And the ways that you catch it are you catch it from community norms. So we know that the stores that they have in our communities, the proliferation of cheap products of stores, and I had a chance to tour a little bit your beautiful city here. So we saw all of the liquor stores, all of the tobacco outlets in the poor African American neighborhoods. And that's the same in the neighborhood that I grew up in. And that's the same across this country. So we want to say that the tobacco industry, they are really a cartel. They are federally adjudicated racketeers. And so they are there seeding this in our community. They are the vector of the disease of addiction in our communities through their marketing and targeting. We met earlier with some people from the Breathing Association, from the Primary One Health Care, and we want to tell you that everyone is looking at your city. This is a legacy for the state of Ohio. We are with you. We will be bringing back an innovative pre-cessation enhancement intervention that we have developed for African Americans that can be adapted for LGBTQ, for youth, and we are going to be donating these services in kind as you roll out this law. We know that laws are not magic. They are the beginning of a process, and we are here with you in that process to make this city a model city of how you do it and how you get it done and how you get it done right. Thank you for your time.
Thank you for your testimony. And last but certainly not least, Alicia Hopkins. Welcome to council.
Thank you. I am not naive to being the last speaker and getting out of here, so I'll try to make it quick.
Take your time.
My name is Alicia Hopkins, and I'm a nurse practitioner with the Breathing Association. I serve the underserved and the uninsured. In the past 20 years, the reduction of teen-age nicotine addiction that's been made has been wiped out by nicotine salt e-cigarettes. I think that needs to be repeated because all strides made in the past 20 years of teenage nicotine addiction has been wiped out by flavored e-cigarettes. According to the CDC, approximately 3.5 million middle schools and high school students are using e-cigarettes. There's evidence that a similar number of college-age students are also regular users. That, my good men and women, is approximately 7 million young people on the road to long-term nicotine use. How grateful we are for the opportunity to be heard as we discuss this epidemic. At this time, there's not a ban on flavored e-cigarettes. There is not one of us in this room that will not be or has not been affected by these statistics. I am a mother of a middle school student She's beautiful and smart. In this room, I'm not alone. We are mothers and fathers, grandparents, aunts and uncles, teachers, medical care providers. It is our responsibility to keep our beautiful and smart children safe. We make our children safe by wearing seatbelts, putting them in car seats, making sure they go to school. It's time to keep them safe from nicotine as it hides behind candy flavoring. For every $1 spent against nicotine use for our youth, there's $27 spent in its favor. I'm a mother and a medical care provider. I need your help. Help us once again reduce nicotine use amongst our youth, and this time, let's not take 20 years. Thank you.
Thank you for your testimony this evening. Before I close, Assistant Health Commissioner Edward Johnson, do you have any closing remarks you'd like to make at this time?
Not at this time. I just wanted to thank you and all of the speakers for coming out this evening.
Thank you. With that, I would like just to reiterate our continued appreciation for our residents, our advocates, those who oppose what is being proposed here tonight, for continuing to be an engaging civil dialogue together. I understand that this topic brings out polarizing opinions and a lot of passion from both sides. As I've shared before, Columbus City Council is committed to continue to listen and to hearing from all of you on this issue. And we are not done listening yet. We will be holding 2 additional small business conversations, a virtual one on November 16th, next Wednesday, and one in person on November 30th. To find details, you can go to www.columbus.gov/tobacco. Columbus City Council is working on capturing all of the feedback we have received thus far and taking another look at the legislation. Our public comment period remains open, and I invite all of our residents to share their feedback by emailing flavoredtobacco@columbus.gov. Additionally, I encourage you all to follow me and Columbus City Council on social media as we continue to share updates and other opportunities for engagement there. Thank you to all of my colleagues, Council President Hardin, President Pro Tem Brown, Councilmember Bankston, Councilmember Remy, Columbus Public Health, Health Commissioner Dr. Mashika Roberts, Assistant Health Commissioner Edward Johnson, Dr. Chaik Dubine, Chris Mago, and all of you for being here with us tonight. It was a long one, but it was very informative, and I thank you and appreciate your time. This will now conclude our hearing. Have a wonderful evening.